Good morning. A quorum being present, the Committee on Education and the Workforce will come to order. Before we turn our attention to this morning's hearing, I'd like to take care of an administrative matter. Today, both the Republicans and Democrats have completed assigning members to the subcommittees. I ask unanimous consent on behalf of myself and Ranking Member Scott to submit those assignments for the record. Hearing no objections, the subcommittee assignments are made. Next, I recognize myself for an opening statement. I again say good morning to my colleagues and guests. I want to welcome our witnesses. We appreciate that you took time out of your busy schedules to be with us today. It's no coincidence that our first hearing is focused on our efforts to rescue Americans from a fatally flawed healthcare law and transition to a patient-centered system. There's an urgent need to address the challenges facing working families and small businesses under Obamacare, and that's exactly what this hearing is about. For nearly 7 years, Americans have struggled as they've seen their health care costs skyrocket, their plans canceled, and their choices and access to quality care diminish. That's why for nearly 7 years, Republicans have been fighting to provide the relief Americans desperately need. This has never been about politics. The fight to repeal and replace Obamacare has always been about people. It's been about people like Steve from my congressional district. Steve resides in West Jefferson, and he and his wife are paying 225% higher premiums than they were 4 years ago. Scott from Hickory, North Carolina, has had his health care plan canceled 3 times because of the law, and today has access to only one insurance provider. Michael from Winston-Salem has an $800 monthly premium for him and his daughter, and their deductible is over $14,000. Terry, a 70-year-old retiree from Advance, is working part-time just to help pay his wife's $900 monthly premium. These stories aren't unique to North Carolina. Working families across the country are suffering under a failed government takeover of health care. Remarkably, the consequences extend beyond higher insurance costs and limited plan options to fewer jobs and suppressed wages. In fact, a recent study by the American Action Forum found Obamacare has destroyed 300,000 small business jobs, and cost small business employees $19 billion a year in wages. An estimated 10,000 small businesses are even forced to close their doors because of the law's burdensome regulations. All these individuals, families, and small business owners were promised far different. They were promised lower cost, more choices, and more competition. What they got was the exact opposite. The reality is the 2010 health care law is completely unsustainable. It's collapsing as we speak. We cannot stand by as the law creates even more havoc in the lives of the American people. That's why we're on a rescue mission to deliver the relief people need, and this committee will play an important part in the process. We've already taken steps to repeal Obamacare, and the Trump administration is actively working to stabilize health insurance markets. Once the law is repealed, there will be a stable transition to a patient-centered system. At least 4.7 million Americans have already been kicked off their health care plans under Obamacare, and the last thing Republicans want is to disrupt more people's coverage. We're going to do this the right way. There won't be a massive bill that no one has read and is yet through Congress in the dead of night. Instead, we will tackle the challenges of our broken healthcare system through step-by-step solutions that provide lower costs, more choices, and protect the most vulnerable among us. We will put patients in control of their healthcare decisions. That means eliminating one-size-fits-all rules that drive up costs and restrict choices. All Americans should have the freedom to select a healthcare plan that meets their needs. After years of costly federal mandates, we will empower small businesses to band together and provide affordable coverage for their employees. Additionally, we will preserve employee wellness plans that have been under attack in recent years by Washington bureaucrats. Undoing damage of Obamacare and achieving real health care reform won't happen overnight. We will continue to hold hearings just like this one, and we will continue to receive input from governors, insurance commissioners, workers, and employers across the country. Today's discussion is an important step in this process. We look forward to hearing from all of you on how we can provide a better way forward on health care for the American people. With that, I yield to Ranking Member Scott for his opening remarks.
Thank you, Madam Chair. And I'd like to, first, before we begin, introduce one new member who's here, Adriano Esplat, represents New York's 13th Congressional District. He wasn't here when we introduced new members before. He has represented the same district as the past chair of this committee, Adam Clayton Powell. He served in the State Senate and State Assembly in New York. We have another member, Carol Shea Porter, who was appointed to the committee. She's from Hampshire and previously served on the committee. I'd like to welcome our witnesses and thank them for their testimony. This is our first hearing, the 115th Congress. Unfortunately, this hearing is part of a larger agenda to repeal the Affordable Care Act, root and branch, despite the fact there's no credible plan to deal with the chaos that repeal would create. First, I'd like to remind our Republican colleagues once again where we were when we passed the Affordable Care Act. Healthcare costs were skyrocketing. If you lost your job or wanted to start a new business and had a pre-existing condition, you were out of luck. Women were paying more than men. Seniors had no help for paying for prescriptive drugs when they landed in the notorious donut hole. Minors suffering from lung disease struggled to get access to health benefits because of complicated requirements that made it almost impossible to prove eligibility. And every year, millions of people were losing their insurance altogether. The so-called damage caused by the Affordable Care Act includes women no longer paying more for insurance than men. The costs have gone up, but they've gone up at 1/2 the rate that they were going up before. Those with pre-existing conditions can get insurance at the standard rate. We're closing the donut hole. We've helped minors get their benefits, and instead of millions of people losing their insurance every year, 20 million more people have insurance, and all of the Americans are that even if they had insurance before are enjoying consumer protections. Small businesses were exempt from virtually all of the provisions of all of the mandates in the bill, and this progress will be reversed if the ACA is repealed. We know, for example, that 30 million Americans would lose coverage, with the vast majority in working families. Workers with job-based plans could lose out on ACA's consumer protections, such as prohibitions against annual and lifetime limits. They could lose out on access to free preventive services, which keeps the American workforce healthier and on the job. These meaningful protections have improved the lives of people around the country, protections that are being threatened. The collateral damage won't stop there. The individual market could all but collapse if there's a repeal without a credible replacement, making it likely that nobody will be able to buy insurance at an affordable rate. Costs for uncompensated care will skyrocket, but those costs won't disappear. When people go to the hospital and don't pay, those costs have to be paid by somebody. When we passed the Affordable Care Act, that cost was about $1,000 on a family policy covering uncompensated care. Coal miners who now benefit from enhanced protections and benefits provided by the ACA could lose them. Now, another important item to both workers and employers, employment. Repeal would devastate communities around the country, particularly rural areas that already face employment challenges. The American Hospital Association and the Federation of American Hospitals sent a letter to congressional leaders warning of massive job losses if the ACA is repealed. The letter noted that this is a specific threat to rural communities, pointing out that hospitals are often the largest employer in many communities. Estimates show that repeal would result in a loss of 2.6 million jobs almost immediately. Over the last 7 years, we've heard a lot of complaints about the Affordable Care Act, but we haven't seen a plan that would actually make things better. Just last week, our colleagues on the Budget Committee held a hearing where healthcare experts from the Urban Institute estimated that if the GOP were to replace the ACA coverage expansion with tax credits at the inadequate level pushed by the new HHS Secretary nominee, the healthcare deductibles could skyrocket to $25,000 for individuals and $50,000 for family plans. Today, we're likely to hear about some other plans that, frankly, just won't work or won't do anything, and there's no strategy or interest in protecting the millions of Americans who now benefit from the ACA. If a credible replacement plan were possible, we obviously would have seen it by now, but there's no legislation pending that has significant support, and there's no reason to believe that a replacement plan could be produced that would actually work. Now, some of the initiatives already taken by this administration have been proven to be counterproductive. For example, the administration took action to threaten the marketplace by pulling advertisements for coverage in the final days of open enrollment period. It is well known that those who wait to the last minute tend to be younger and healthier, and few of them signing up just means higher premiums for everybody else. Now, it's unanimous consent to insert into the record a letter sent by 3 ranking members of House committees with healthcare jurisdiction to the Department of Health and Human Services asking for further details on the impact of this decision.
Without objection.
Thank you. Even President Trump's recent immigration order not only runs afoul of American values and our Constitution by essentially creating a religious test for entry into the United States and denying due process, but it also has an impact on health care in the United States. The Association of American Medical Colleges, one of the many groups to express concern over the executive order, released a statement explaining that the executive order could disrupt education and research and have a damaging long-term impact on patients and health care. So we have a few options. We do have a few options moving forward. We could choose to move to a single-payer system, or we could improve upon the ACA. Going back to the days where a pre-existing condition meant you couldn't get insurance should not be an option. Now, since this is our first hearing in Congress, let me be clear about our shared priorities and the vision of Democrats on this committee. We are here to strengthen economic security of Americans and to protect the health care in this country. There is more that we need to do to improve access and affordability in health care, and Democrats are willing to work on responsible improvements. If the goal is to replace, then repeal, we can work together, but you cannot count on our support if the first step is to create total chaos by repealing without any replacement in sight. In fact, Democrats are skeptical that there'll ever be any replacement. We're reminded that the majority of the Republicans in Congress did not support Medicare. We know that over 60 votes have been taken in the House to repeal all or parts of the Affordable Care Act without any replacement in sight. And we've already missed the legislative deadline under reconciliation. The two committees were given instructions to come up with changes in the Affordable Care Act, and they've missed that deadline. And so we're skeptical that there'll be any replacement if there is a repeal. So it is my hope that we can focus our efforts on the financial security of American families by working to improve health care instead of turning the clock backwards and ruining health care possibly for everybody. Thank you, Madam Chair, and I yield back.
Thank you, Mr. Scott. Pursuant to Committee Rules 7C, all members will be permitted to submit written statements to be included in the permanent hearing record. Without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material referenced during the hearing to be submitted for the official hearing record. We'll now turn to introductions of our distinguished witnesses. Dr. Tevi Troy is the Chief Executive Officer of the American Health Policy Institute. Previously, Dr. Troy held numerous positions in the federal government, including serving as Deputy Secretary of Health and Human Services beginning in 2007, where he oversaw all operations including Medicare, Medicaid, public health, medical research, food and drug safety, welfare, child and family services, disease prevention, and mental health services. Mr. Joe Eddy is President and Chief Executive Officer of Eagle Manufacturing Company and will testify on behalf of the National Association of Manufacturers. In addition to his work at Eagle Manufacturing, Mr. Eddy also serves on the advisory board of the McDonough Center for Leadership in Business at Marietta College and the foundation board at West Virginia Northern Community College. Ms. Angela Schlock is a widow, mother of 2 children, and a student at Siena Heights University, pursuing a bachelor's degree in communications. She is an educated grief group facilitator at Lori's Place in St. Joseph, Michigan. Lori's Place serves children and adults who've suffered a death or dealing with anticipatory grief. She's active also in fundraising for the Leukemia and Lymphoma Society. Mr. Scott Bolenbacher is the creator and managing partner of Bolenbacher and Associates, LLC, a certified public accounting firm serving mainly small to mid-sized businesses in north central Indiana and western Ohio. As a CPA, Mr. Bolenbacher provides accounting and tax services to clients in manufacturing, agriculture, retail, and professional services trades, as well as not-for-profits and individuals. Mr. Bolenbacher is testifying on behalf of the National Federation of Independent Business. I will now ask our witnesses to raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Let the record reflect the witnesses answered in the affirmative. Before I recognize each of you to provide your testimony, let me briefly explain our lighting system. We allow 5 minutes for each witness to provide testimony. When you begin, the light in front of you will turn green. When 1 minute is left, the light will turn yellow. At the 5-minute mark, the light will turn red, and you should wrap up your testimony. Members will each have 5 minutes for 5 minutes.
Thank you, Member Scott and members of the committee. Thank you all for the opportunity to testify today on the effects of the Affordable Care Act on large employers and their employees, as well as how to advance patient-centered solutions going forward. My name is Dr. Tevi Troy. I am CEO of the American Health Policy Institute, nonprofit research organization focusing on employer-sponsored healthcare benefits. I also served, as you mentioned, as a senior White House aide in the George W. Bush administration and Deputy Secretary of HHS. While the public debate over the ACA appropriately focuses on the 20 million Americans who are receiving coverage through its exchanges, Medicaid expansion, and other provisions, the ACA also significantly, and in many cases unnecessarily, increased the regulatory requirements and burdens on employment-based healthcare that covers more than 177 million Americans. Too little attention has been focused on this important aspect of the law. In this time of transition on healthcare, it is important to protect those who have gained coverage under the ACA, but it is also a critical priority to protect those who are covered by employers. There is clear evidence that the ACA has both directly and indirectly increased the cost of employer healthcare benefits. In 2014, an American Health Policy Institute study found that over the next decade, the cost of the ACA to large employers, 10,000 or more employees, will be about $4,800 to $5,900 per employee over a decade. My written testimony includes other studies showing how the ACA has increased employer costs, and I ask that they be submitted for the record. Furthermore, the regulatory burden the ACA imposes on businesses and individuals should not be underestimated. Since the ACA was enacted, 106 regulations implementing the law have been published. These regulations will cost the private sector more than $51 billion and require 173 million hours of paperwork in order to comply. These cost increases come from a number of ACA provisions that have a direct impact on employees and employers and on the cost of their health plans. Now, going forward, I believe that we should move toward a more patient-centered healthcare system and look to the private sector to lead transformation efforts. In order for the private sector to be innovative, it is imperative to protect the tax exclusion on employer-sponsored healthcare benefits as well as the ERISA preemption. For more than 60 years, employer-provided health benefits have been excluded without limit from income and payroll taxes. Over time, this benefit has helped make employer-sponsored care a basic building block of our healthcare system. Given the role of employer-sponsored health insurance in providing stability in coverage to so many Americans, making a substantial change to the tax treatment of employer-provided health care could cause a significant disruption. We strongly support the bipartisan effort to repeal the ACA's 40% Cadillac tax on employer-sponsored health benefits and urge Congress to repeal this tax along with other ACA taxes and fees. We have seen how problematic the taxes approach is by its opposition from both business and labor. We are glad that the tax has been delayed until 2020 and hope to see it repealed soon. Reducing or eliminating the tax exemption on employer-sponsored health care would raise the same problems as the Cadillac tax. It would serve as a middle-class tax hike, drive up health insurance costs for millions of American employees, and eliminate the strong incentives currently in place that constantly pressure large purchasers of health to demand more efficient, affordable, and effective health care from the marketplace. Getting rid of or reducing the tax preference would also harm efforts to maintain strong risk pools and to cover the maximum number of people. As we have learned from experience with the ACA, encouraging people to get covered is a costly and challenging endeavor, and risk pools are difficult to maintain as well. Employers, however, are both getting good at getting people covered and at maintaining manageable risk pools. Public policy should aim to encourage these important goals. As economist Peter Nelson has said, employers do get people covered. They very successfully get people covered. A second key issue is the ERISA preemption. ERISA is the foundation of employer-sponsored health benefits, and we encourage you to strengthen the protections in the law. The longstanding preemption provision is vital to multi-state employers because it enables them to offer uniform nationwide health care benefits at the lowest possible cost to employers, no matter what state they live in. This leads to better benefit design, a reduction in administrative costs through economies of scale, increased purchasing power, and greater innovation. Without it, an employer doing business in 50 different states would be required to comply with 50 different state healthcare laws, something that would make administering a healthcare plan a complex nightmare. In conclusion, I appreciate the opportunity to testify here today about the importance of employer-sponsored coverage and its importance to our system. Going forward, our policy should not be to increase the burdens or costs on employers and the 177 million employees and dependents who get coverage through the employer-based system, but to encourage that coverage for the benefit of our system as a whole. Thank you for having me here today.
Mr. Eddy.
Thank you. Good morning, Chairwoman Fox, Ranking Member Scott, and distinguished members of the committee. Thank you for the opportunity to appear here today before you and for holding this hearing. My name is Joe Eddy. I'm President and CEO of Eagle Manufacturing Company in Wellsburg, West Virginia. I'm currently on the Board of Directors of the National Association of Manufacturers, also known as NAM, and also serve on their Small and Medium Manufacturers Group. The NAM is the nation's largest industrial trade association and a voice for more than 12 million men and women who make things here in America. Eagle Manufacturing Company is a family-owned business established in 1894. We employ approximately 195 employees and are a prime manufacturer of safety cans, safety cabinets, secondary spill containment products, poly drums, and material handling products. At Eagle, we design and manufacture all of our own products. We are a respected brand name across the world for consistent quality and value, and all of our products are still made in the United States. Manufacturers have a proud tradition of providing health insurance for their employees. At Eagle, our tradition has been to cover 100% of medical costs. We have done this because it's the right thing for our employees and our community. No government policy or mandate leads us to provide this generous benefit. We often hear that people specifically want to come to work at Eagle because of our reputation of taking care of our employees. We live by our mission statement, protecting people, property, and the planet. Unfortunately, the last few years under the Affordable Care Act have made it more difficult to live up to our own standards. Rising healthcare costs have forced us to make some difficult choices, and the ACA has further limited our options. In 2009, prior to the ACA, we were paying about $13,500 per year per employee. And by 2013, those costs increased to over $15,800 per year per employee. The additional taxes, paperwork, fees, and mandates of the ACA cost us nearly $1,000 per year per employee. As much as we work to keep costs down, our plan now costs over $22,800 per year per employee. We do not think that our benefits are excessive. They are necessary to attract, retain, and maintain a strong, quality, and healthy workforce. And I am not alone. 98% of NAM members offer health insurance to employees, and the cost of health care remains a top business concern for both large and small manufacturers. These rising health care costs impact all facets of any company: hiring new workers, maintaining competitive pay rates, making capital investments, as well as our decisions in researching and developing new products. Part of the challenge that the ACA ushered in was a paradigm shift in healthcare choices available to manufacturers and other business owners. More specifically, the insurance that we had for more than 10 years was no longer available. Many of our employees had to find new doctors, and we had to learn to manage an entirely new system. Furthermore, the new product we purchased was more expensive, driving our healthcare costs up that year an additional $4,000 per year per employee. Unhappy with the outcomes of this change, we switched carriers again to another insurer. We are hopeful that our situation has stabilized, but businesses such as ours need flexibility and competitive options so that we can always find the best and most cost-effective plan for our employees. Perhaps the most challenging part of the ACA is the effect it has had on our employer-employee relations. As I mentioned earlier, Eagle has 195 employees, but it should be noted that 150 of those are unionized through the United Steelworkers Union. We have traditionally had a strong relationship with the union and our employees. However, last year during contract negotiations, for the first time in our history, we had to negotiate a cost-sharing arrangement with the union. The union members now have to contribute $35 per pay, or $910 per year towards monthly health care premiums. As you would imagine, those were not easy negotiations, tending to break down the trust and partnership that we had established through the many years between the company and our employees. The years following the passage of the ACA have been costly, disruptive, and distracting from the things that we are really good at doing as manufacturers. Moreover, the dose of uncertainty delivered to us over 7 years ago still has not been fully resolved. Eagle is very proud of our 123 years in West Virginia, manufacturing innovative, quality products for our customers. As a leader in the Wellsburg community, we strive to provide health care benefits that allow for a strong, healthy workforce, but it is a struggle given the limits, restrictions, and mandates of the Affordable Care Act. I know that my struggle is not unique and that many manufacturers across the country are facing the same challenges. I very much look forward to working with you to find a workable solution that will help control outrageous costs and provide the flexibility for employers to continue to provide the benefits their employees deserve. Thank you for inviting me to testify before you today, and I'm happy to answer any questions. Thank you.
Thank you very much. Ms. Schlock, you're now recognized for 5 minutes.
Good morning, Chairwoman Fox, Ranking Member Scott, and the members of the committee. Thank you very much for inviting me to attend this session today. My name is Angela Schlock, and I'm originally from Central Texas, but have been a longtime resident of St. Joseph, Michigan. I'm here today to share with you a little bit about how the Affordable Care Act has impacted my life and the lives of my family. Never could I have imagined the life-changing events that would bring me here today. In November 2013, my husband, Michael Schlock, suddenly had 3 days of extreme fever, headaches, and sweating. Michael was diagnosed with the most aggressive form of acute myeloid leukemia, and he had mere days to live. He was 44, exercised, did not smoke, got routine medical checkups, and had no prior health issues. He was admitted to the University of Chicago Medical Center's Leukemia Intensive Care Unit that night, and as our local hospital does not have the ability to treat this type of disease. The University of Chicago is about 90 miles from our home, and the distance created an additional hardship on our lives. His diagnosis meant he was forced to take an extended leave from work, as living with AML is a full-time job in itself. His employer, Whirlpool Corporation, was supportive and thankfully very generous in their benefits. Little did we know at that point the cost of treating leukemia and how valuable our health insurance would be. The only cure as of now for AML involves chemotherapy and donor stem cell transplant. Not only were we responsible for Michael's medical expenses, but patients are also responsible for those of their donor. After 6 weeks of chemotherapy to keep the leukemia under control and preparation for transplant in place, Michael was able to return home for a few weeks before returning for another minimum 6 weeks inpatient. In those weeks at home, we still had to return to his hematology oncologist 2 to 3 times per week. At this point, we were beginning to realize the financial magnitude of what treatment for leukemia entails. Our bills were exceeding $1 million already. Within 3 months of his stem cell transplant, Michael's leukemia relapsed with a vengeance. At this point, the only options were clinical trial therapies. We spent the next 4 months in and out of the hospital in Chicago, and he needed blood transfusions every few days. 1 bag of blood, which he was receiving multiple units of per week, was over $1,500 each. In addition to the 20 or so prescriptions he was taking, the constant trips for doctor visits to Chicago, we still had to maintain our household financially. With the extreme physical, mental, and emotional stress that came with this journey, one thing we did not have to worry about was the fact that we knew our insurance would not cut us off after any lifetime maximum. Hoping Michael would survive, we knew despite this now pre-existing condition, he would stay covered and not be discriminated for something he had no control over. The provisions of the Affordable Care Act kept us from filing bankruptcy and losing what we had built up in our over 20-year marriage. The expenses incurred in a matter of 10 months were nothing any health savings account could properly fund. We had peace of mind knowing Whirlpool's insurance would take care of us. In September 2014, Michael died at age 45 of AML. As I had been a full-time caregiver to him, in addition to trying to maintain some normalcy for our family, I was not employed. I was a stay-at-home mom to our then 10-year-old daughter. Our young adult son was in graduate school at the time and was entering the Peace Corps after graduation. Whirlpool graciously covered the 3 of us under their insurance for the rest of the calendar year. Though offered COBRA benefits beginning in 2015, the premiums were beyond anything I could afford. I was able to take advantage of something I never expected to need, the healthcare marketplace. Knowing I needed to continue to provide for myself and daughter from here on out, I decided to go back to college to complete my degree. Having access to the marketplace gave me the ability to provide excellent coverage for us at an extremely low monthly rate and not have to return to work yet, simply to have the benefit of health insurance. We were able to keep our same doctors, and while dealing with our grief in this new life, the ability to have full coverage, including mental health benefits, was one less worry. Though I'm just a common person from a small town in the Midwest, I know my experience with devastating health issues and having my whole world turned upside down in the blink of an eye is not uncommon, and anyone can be one illness away from losing everything they have. Our bills were nothing a health savings account could have remotely covered. Had Michael survived, he would have had a major pre-existing condition, and being that AML has genetic links, our family is at risk for facing similar situations down the road. The Affordable Care Act has helped keep my life moving forward. It's given me the ability to continue a healthy life with access to routine care and without worry that one hospital admission could cost me everything. I implore you to please consider the benefits that this Affordable Care Act has provided. Whether through an employer or the marketplace, everyone deserves that peace of mind. Thanks for your willingness to hear my voice.
Thank you very much. Mr. Bollenbacher, you're recognized for 5 minutes.
Good morning, Chairwoman Fox, Ranking Member Scott, and members of the committee. My name is Scott Bollenbacher, and I'm the managing partner of Bollenbacher and Associates, a CPA firm serving individuals and small business clients, most of which are family-owned. I started the business in 2004 with 6 employees serving 400 clients. We have grown to 11 full-time employees and 6 part-time employees serving 1,600 clients. I am pleased to be here on behalf of the NFIB to discuss how the ACA has impacted our business and our clients at today's hearing. As a small business, we're a close-knit family. Our employees are much more than employees. They are our friends. We care deeply for them. We care for their families. We want to provide for them, provide benefits and help in any way we can. We know that our success as a business depends on our team. Most of our employees have been with us for 10 or more years. From 2004 to 2014, our firm maintained a high-deductible health insurance plan accompanied by a health savings account. The firm paid the entire premiums and funded up to $3,000 per year to the employees' HSA. This plan worked well for the business and our employees. We saved tax-preferred funds for predictable and unforeseen medical expenses. In late 2014, we learned that our policy no longer qualified under the ACA because it did not cover essential health benefit package, specifically pediatric dental coverage. I requested the benefit be added, but it was unable to do so, and we lost our plan. We did not know what to do, and we had little time to choose a new option, but we explored all the available options with a consultant. We considered that purchasing in the shop exchange. However, the plan would have cost over 50% more than our previous plan with less coverage. We considered dropping health insurance altogether and increasing the employee's salary to help them purchase insurance on their own. IRS restrictions made this very difficult. We considered health care and sharing ministry called MediShare, and we considered self-insuring. The only feasible option at the time was a partially self-funded plan. I believe our firm was the smallest group they accepted at the time. The premiums were similar to our previous plan, but the coverage was not as good. It carried a higher deductible and did not cover vision care. It did not cover my family doctor. We maintained this coverage for 2 years. In the fall of 2016, we learned that our carrier no longer wanted to offer self-funded health plans to small businesses, so they proposed to raise our premiums by 156%. We could either pay the increase or leave. We left. Essentially, our plan was canceled again. As with most small business, we must watch our expenses. A 156% increase is not possible. Once again, we worked with our benefit consultant to explore all options. Shopping for the right plan is complicated for us because the firm is close to the Indiana and Ohio border. Our employees live in both states. We must find a policy that is accepted by doctors and hospitals on both sides of the state line. We finally settled on another fully, We finally settled on another fully insured plan at a 78% increase. It was our only available option. Most of our employees like the HSA option we maintained for 12 years, but this plan is not HSA eligible. The experience has been frustrating and stressful. The increases in cancellation are unsustainable for a small business like ours. Many clients experience similar disruption with premium increases and plan cancellations. A church can no longer provide 3 ministers with tax-preferred money to purchase coverage in the individual market due to IRS guidance. The pastors ended up purchasing coverage on the individual exchange that was twice as expensive because they did not qualify for a subsidy. Manufacturer with 25 employees could no longer contribute the entire premium to their employees after excuse me, a 44% increase to their 2017 plan. A pellet manufacturer with 110 employees who could neither afford the $500,000 insurance nor the $70,000 employer mandate penalty was forced to terminate 80 employees and subcontract some of the work. A farmer couple who earns just above the subsidy had to pay a 38% increase after their plan was canceled. And a single female business owner suffered a policy cancellation, forcing her onto the individual exchange marketplace where premiums doubled without a subsidy. I want you all to know that what's going on in the real world with average Joes and Janes. We work very hard. I brought a picture of our team today so that you see that we're real people. We've been hurt badly by the cost increases caused by the ACA and request your assistance in fixing this. As you consider repealing and replacing ACA, I encourage you to focus on lowering the cost and increasing flexibility for small businesses. Thank you again for allowing me to share my story today. I'm happy to answer any questions.
Thank you very much. Thanks to all of our witnesses. And now we'll recognize members for 5 minutes of questioning, and I'll begin with Dr. Rowe.
Thank you, Dr. Fox. And first of all, Ms. Schlack, I want to offer you my condolences for your loss. 2 years ago today, I was sitting home with my wife who's dying of cancer. So I have certainly, my sympathy goes out to you and your family.
Thank you.
I share your grief.
Thank you.
You know, we had a promise from the administration when we started debating the Affordable Care Act to increase access and lower cost. And I think certainly everybody agreed with that. I know on our side of the aisle I did, and you all don't know me, but I'm a doctor that practiced medicine for over 31 years before I ran for Congress. And so what did we get? We got some increased access, but at what cost? And I know at our local hospital at home, 60 to 70% of the uncollectible debt, now it's $1 billion healthcare system, are people with insurance. And certainly we agreed on the pre-existing conditions. Everybody on this dais agreed with that. And lifetime limits, I think that certainly was something that we all agreed on because healthcare is more sophisticated and costs more money than it used to. And we created this incredibly complex plan. And I said this 7 years ago in an article I wrote. I could have done 3/4 of what the ACA did in 2 paragraphs. And I've just heard the data that once again proved that. Mr. Scott pointed out that 20 million people who weren't covered are. Over half of them are Medicaid. We could have expanded Medicaid and allowed 26-year-olds to stay on their parents' health care plan. That would have covered, along with the 5 million people almost who lost their insurance, including me. I had perfectly good health care insurance and lost it and had to go on the ACA. You ended up with 80%. All these regulations and things that these 3 witnesses have talked about could have been avoided easily. In my own state, almost as many people pay a penalty, a tax, a fee, whatever Judge Roberts labeled it, as get a subsidy. And for the people who get a subsidy, it's a good deal. The problem with it is there are millions of other people out there in small businesses who are being harmed by this. I was a mayor of my local community before I got elected, and we had to pay $180,000 fee so that insurance companies would stay in the market. 18 of the 23 co-ops, one in the state of Tennessee, went broke to the tune of billions of dollars of costs of really no health care got provided. Just the taxpayers were on the hook for this. And I can tell you flatly, we went through this over 20 years ago in our state, health care reform. I could have written the epitaph of what's happening. If we don't do something, we cannot not do something, because no one's going to be able to afford health insurance coverage any longer if we don't. I mean, Bill Gates won't be able to buy a health insurance policy. When you're talking about $22,000, that makes you not competitive with other people in foreign countries, and eventually you will lose your business. Mr. Bollenbach, you mentioned about one of the things we want to do is go across the state lines. I have a city in my district, Bristol, Tennessee, Virginia. I mean, the center street of that, one side you're in Virginia, one side you're in Tennessee, but you can't purchase health insurance. And Mr. Scott mentioned there are no plans. There are. I've written one, and it has 130 co-sponsors. It's been submitted, and we'll have some version of that. What I want to know from you all at the dais is what can we do? What would you expect us to do when we rewrite this policy? What could we do to help you lower the cost and increase access, which was the premise of the ACA to begin with? Anyone can take it.
I'll step in. Thank you for your statement, Mr. Rowe. So we believe that the way to approach this is to try and incentivize the purchase of health care by lowering costs overall. What the ACA did, as you so cogently said, was to increase costs for everyone and subsidize a select few. I think a better approach would be to try and make it cheaper overall to reduce costs, and there have been a number of Republican plans that have done this via HSAs, health savings accounts, purchase across state lines, tort reforms, and association health plans that would allow people to get the tax benefits not just through their employer. And a combination of those things have been scored by the Congressional Budget Office as having the effect of reducing overall premiums.
And Ms. Schlock mentioned, I use a health savings account and have since the day they came out. And for most people, for her, she's right, it would only have covered part of the cost of that, not this astronomical cost. But for most of the care, it would work just fine. And the cost of the ACA, I've personal testimonial. I had major back surgery in September of this year. I looked at all the bills I got for the doctor, for the hospital, for the anesthesia, the MRIs, all of that. At the cost of the ACA, they still made money on me this year. My premiums were that expensive, and so I can pay that. But the average person where I live in rural Appalachia, which is what I represent, cannot. With that, I'll yield back.
Mr. Scott, you're recognized for 5 minutes.
Thank you, Madam Chair. Madam Chair, I'd like unanimous consent to enter into the record a report prepared by the committee staff on the Democratic side showing the benefits of the Affordable Care Act.
Without objection.
I'd like to ask all the witnesses if they, if any, support a total repeal of the Affordable Care Act without any credible replacement. Anybody? And the record reflect that nobody volunteered. Does anybody propose, we have a mandate that individuals buy coverage. Do any of the witnesses propose to eliminate that individual mandate?
I don't think the individual mandate is effective, sir. And then also on your previous statement, I want to make sure that it's the, we oppose the repeal without any alternative, but I think there will be an alternative.
Okay, well, if you eliminate the mandate for individuals, could you cover those with pre-existing conditions?
I think there are a number of proposals that look at covering people with pre-existing conditions, especially those who maintain continuous coverage, and then also having high-risk pools to address those people if it's designed correctly.
Has that ever worked anywhere, covering those with pre-existing conditions without an individual mandate?
We're obviously going into new places in healthcare, new directions, so I'm not aware of anything.
Well, that's not a new direction because they tried it in New York, and when the Affordable Care Act came in, the individual prices in the individual market were cut 50%. The governor of Washington State has indicated they tried it in Washington, and they had to repeal the whole thing because nobody could buy insurance if you didn't have the individual mandate. So it's not real new. Now, some of the witnesses have talked about the costs going up since the Affordable Care Act. We didn't hear much about the costs going up before the Affordable Care Act. If the witnesses could present, Mr. Eddy and Mr. Troy, what your cost increases were the 10 years before the Affordable Care Act. We'd appreciate to see that because all the studies have shown that the cost increase since the Affordable Care Act have been, on average, about half of what the increases were before. Could we get that? Could you provide that for us?
Yes, we actually prepared that, sir, that from 1999 to 2005, employer-provided health care costs for family coverage were increasing by an annual average about 11.1%. From 2006 to 2010, we saw a number of steps by employers to reduce costs, including the implementation of CDHPs, consumer-directed health plans, wellness programs, and other benefit plan innovations, and as a result, the annual increase dropped to 4.8%, still high, but much lower. And then in the intervening period from 2010 to 2016, the annual increase has been 4.7%. This reflects the net cost increases and decreases from the ACA and additional cost savings innovations by employers. And we believe that without the cost increases by the ACA, that 4.7% figure would be even lower. So it is absolutely true that costs have been going up over time, and we're looking for ways to continue to moderate those costs through innovative programs by
Well,
employers.
if you could show us that 11%, because that's about what they were, that's consistent with what most increases were before the Affordable Care Act, and the 4% is consistent with what most of the, closer to what the increases have been since the Affordable Care Act. So complaining about the costs going up without pointing out that they're going up a lot faster before the Affordable Care Act tends to be a little misleading. Some of the plans that have been referred to point out that you can reduce costs, but all of those plans appear to just shift the cost to the patient by cutting benefits. The patients can be just as sick, probably going to get the same kind of treatment, but just have to pay more. Ms. Schlock, can you say where you would be without the Affordable Care Act?
I'd probably still be paying bills from 3 years ago. My daughter and I wouldn't have been able to afford any health insurance if we wouldn't have had the marketplace to go to. Where my COBRA payments were going to be $1,000 a month for the two of us, with the marketplace, our premiums were under $100 a month. We had deductibles that were possibly $500 a month the first year, and the second year they were lowered. We very well could have been bankrupt from well over the $1 million that my husband's medical expenses racked up in, again, just 10 months' time.
You mentioned the lifetime cap. What did you mean by that?
I know prior to the ACA, once some employer or some insurance companies, once you hit $1 million, you could be penalized and not be able to get insurance ever again. And like I said, had he survived, he could have possibly not ever been able to get coverage from anyone.
The gentleman's time has expired. Mr. Wahlberg, you're recognized for 5 minutes.
Thank you, Madam Chairman, and appreciate this hearing. Of course, what we desire is that people in general, across the spectrum, be covered and have better opportunities for health care. We appreciate the fact that some have had good results, but we want to do this for all. And so we need to take this seriously here. Dr. Troy, you cited several studies in your testimony predicting that the ACA would increase the cost of offering coverage for large employers. These studies were conducted in 2012, 2014, and even 2016. Has this prediction come to be?
Thank you for that question, sir. So two points on that. First, number one is the studies in 2012 and our study in 2014 that I mentioned that would increase costs $4,800 to $5,900 for an employee over a 10-year period. These were numbers that were produced by teams, benefit teams at large employers that were reflecting what the CEOs and CFOs were looking at in making their determinations. So it is very important to look at those projections and saying that these affected how employers looked at the plans going forward. The second thing, there has been a recent study that has found large costs associated with general ACA administrative costs, reporting disclosure and notification costs costs associated with benefit plan design changes related to the ACA, costs of adjusting benefits to keep up with the ACA affordability requirements, and PCORI fees. So those are some of the biggest recurring costs. One cost that has not come to fruition at this point is the Cadillac tax, which was delayed in a bipartisan effort, which we applaud, and would impose extremely large costs on employers if it were to be instituted going forward, and so we would like to see its repeal.
So basically, costs did increase, as you suggested in the studies. What were the biggest contributing factors to those increases?
So I mentioned a number of those, so I'll be a little more specific. So the age 26 dependent coverage, which I recognize is popular, one company said that it could cost about $69 million over 10 years. Another one estimated about $56 million over 10 years. In terms of the transitional reinsurance fee, estimated costs of $15.3 million from 2014 to 2016. 100% coverage of prevention services and other benefit mandates. One company said that this would cost them about $36.5 million over 10 years. And again, the big five are the ACA administrative costs, the reporting disclosure notification costs, the costs associated with plan design changes, the cost of adjusting benefits, and the PCORI fee.
Okay, these are things we need to work on. Mr. Eddy, thank you for your testimony, and it's admirable that your company traditionally paid 100% of the medical costs for your employees, and it was your desire to continue doing that, as a good number of businesses I've interviewed in my district as well, who literally at times with tears in their eyes with their insurance agent sitting next to me, talked about what this would mean to them to change a process that they felt they wanted to continue because of the family, as they called it. It was the right thing to do. It's understandable that it was not sustainable under ACA, and it's no surprise that your colleagues in the manufacturing business continue to cite the cost of health care as a top business concern, according to the National Association of Manufacturers. Could you tell the committee more about the difficult choices ACA forced you to make in breaking with the tradition of providing this type of coverage for your employees?
Yes, sir. Thank you, Congressman. You know, the difficult decisions really started with the implementation of the ACA during the tough times of a really bad recession. And it couldn't have been a worse time. And the decisions that we've had to make now, we seem to focus more on how we're going to try to manage things like hiring people that we need and how soon people have to retire now. Every decision that we make now revolves around the costs and the uncertainties really afforded to us by the Affordable Care Act. So the tough thing we had to do, we always like to try to take care of our employees, and that's not only with good salary but also good benefits. That's why we've always had that as a company philosophy. Asking them to participate in health care, as you said, it has really disrupted the relationship between management and union management and the salary group as well, because they pay more than the union does for their health coverage now. It's just a matter of trying to keep them accountable and realize what the additional burdens that we've had to take on here. The bad part for the union and the company is I truly believe we could have added another 20 to 25 people in the last 5 to 7 years if we didn't have the additional burden of the Affordable Care Act. I'm not sure where the increases would have taken, but we didn't see the major increases. Now, as an employer, we look for flexibility. That's all we can ask you as you're working on the ACA, to give us some more flexibility as an employer as well as options. And without that, the uncertainty going forward, it really delays any options for hiring people, developing new products. It's really created a major burden. Thanks for your question.
Thanks for your response, and my time
has expired. Mr. Polis, you're recognized for 5 minutes.
Thank you, Madam Chair. I thank the chairwoman for yielding and the witnesses for coming. We're here today to discuss the Affordable Care Act and its repeal. This committee's held a number of hearings in this area, and particularly to highlight the dangers of repealing the Affordable Care Act without a replacement that improves and builds upon it. Of course, I would note that the title of the hearing is somewhat deceptive. It's called Rescuing Americans from the Failed Healthcare Law and Advancing Patient-Centered Solutions. Obviously, we hope that we can move forward in a way to improve upon the healthcare law and leave something in its place that's better. It has been 6 years since the law passed. Before the passage of the Affordable Care Act, about 48 million Americans had no insurance, and now that number's fallen to 28 million. For the first time, being a woman is no longer a pre-existing condition. A diagnosis in childhood doesn't preclude coverage as an adult, and cancer survivors can't be sent to bill for their radiation after hitting their coverage ceilings for the year. As was indicated in the testimony, medical bankruptcies can be avoided. The statistics bear that out as well. In my home state of Colorado, I'd like to submit a letter from our Governor Hickenlooper urging this body to protect health care coverage for 600,000 Coloradans. Without objection, Madam Chair, I'd like to add that to the record. And I'd also like to share a couple stories as well. A few weeks ago, Elizabeth Robinson, a constituent of mine, called my office in Boulder. She works as a homeless navigator for Boulder Municipal Court. For Elizabeth, the expansion of Medicaid that Colorado and 31 states took advantage of has been absolutely critical for serving the homeless population with which she works. She urged me specifically to oppose repealing the law because of the dramatic consequences to the most vulnerable. I also received an email from Dorothy, who shared her story. She's from Louisville, Colorado. 63 years old, self-employed, earns less than $20,000 a year. Thanks to the subsidies on the individual marketplace, she finally has coverage that's affordable as she waits for her Medicare eligibility. Elizabeth is an advocate, Dorothy's a patient, but both of them believe strongly the Affordable Care Act is working for them. My first question is for Ms. Schlack. According to January reports from the Commonwealth Fund, repeal would cost $54 million in gross state product and $1.8 million for Michigan alone in local and state tax revenues. In addition to your personal responsibilities, are you also concerned about this negative fiscal impact on your state that repeal would produce?
Well, sure. In Michigan being a lot of manufacturing facilities that struggle as it has been for a while. Also, like the area where I live is right on Lake Michigan, and it's a heavy tourist economy. And when people don't have jobs, they don't have extra money to spend, and the tourist economy is going to suffer. And the small community where I live, a lot of it is based around tourism.
Thank you. Dr. Troy, I appreciate in your written testimony where you said it's important to protect those who've gained coverage under the ACA. What concerns me is the CBO has made clear that repealing the ACA would cause over 30 million Americans to lose their insurance. Would your organization oppose legislation that doesn't maintain those coverage gains made by the Affordable Care Act in some way, shape, or form?
Thank you, Congressman, for the question. As I said earlier in my testimony, I do believe it is important to protect the 20 million who have coverage via the ACA. I think the CBO study suggests that that is just if you repeal it and do nothing in its place, you would have the number of people without coverage, and I think that would be a problem. So we want to build upon the existing building blocks of American healthcare, the successful ones, such as employer-sponsored care, and make sure that we can expand coverage and maintain coverage for all.
So I think you said it would be a problem if it didn't maintain that coverage. Is that what you said?
We absolutely would like to maintain coverage levels, yeah.
Mr. Eddy, you mentioned some of the, this is on the pay-for side, the way that the Affordable Care Act was paid for. You mentioned in particular the so-called Cadillac tax. There's other aspects like a tax on unearned income, medical device tax. I'm not aware of your organization's position on all of those, but certainly you've made it clear you oppose the Cadillac tax. Do you have other ideas for how to pay for an ACA replacement? Have you, whatever takes the place of it, have you put other potential pay-fors on the table that are acceptable to you?
No, Congressman, I have not seen anything else that's...
Does your organization propose any, or do you simply oppose the current ones?
There are some provisions of the ACA that
Pay-fors, the ways that it's paid for, the revenues.
Well, I don't support the fact that it's a mandate and has to be paid with penalties if not. I think that, and I understand why they're the mandates and the health insurance industry fees. The fees are really what the pay-fors, the additionals,
Right.
where that amount could have gone to health coverage for our employees.
Well, my time has expired. In concluding, I would just say, it's fine to oppose particular ways of paying for it, like fees and certain taxes, but obviously if something has to be paid for, so maybe you can put in the future some on the table. We'll be happy to submit that to you in writing after the hearing as to how you would like to pay for the replacement for ACA, and I'm yield back the balance of my time.
The gentleman's time has expired. Mr. Rokita, you're recognized for 5 minutes.
I thank the chairwoman. I also thank the witnesses for your testimony today. I learned a lot from each of you. I want to start by commenting on some of the comments made by the ranking member, a dear friend of mine, Mr. Scott. Talked in his opening statement about a budget committee hearing. I happen to be an officer on that committee, and I just want to say, well, I don't dispute that there was some testimony given at that committee hearing along the lines of what Mr. Scott was talking about. The overwhelming testimony last week in the Budget Committee was that, and these were experts in the field of healthcare and the economy in both, was that Obamacare was roundly criticized. That in fact, if it was left to go on, it would implode. That the fact that you had another major government control in people's lives only meant that costs were going up and choices were going down. So that was the takeaway from the Budget Committee witnesses last week when we examined this. And it's not any different than the other examinations we've had on Obamacare over the last several years. Mr. Scott also talked about some misleading figures about the increase in costs and whether or not the increase in costs actually went down over with Obamacare, or whether if we didn't have Obamacare, costs would continue to increase at a higher rate. What I find to be misleading about the 6 years or so that we've had Obamacare is statements like this: if you like your doctor, you can keep your doctor. That, in fact, is wrong. If you like your health care plan, you can keep your health care plan. That, in fact, is wrong. There are over 1,000 counties in the United States right now that only have one choice on the exchange for a health care provider. In fact, it's gotten worse. And then the cost was told to us to not be more than $2,500 per family or something along those lines. And of course, we've blown through that figure almost immediately. So, where are we today? I'd like to recognize my fellow Hoosier, Mr. Ballenbacher. Great, I'm glad to see you here. I'm very familiar with your area of the state from when I served as Indiana Secretary of State. Can you explain a little bit about how a small accounting firm owner from northern Indiana winds up testifying before this committee on this issue? Did you ever think that'd be the case? And can you go into a little bit more detail?
Thank you. In the fall of 2016, we received a renewal for our health insurance of 156%, and it just blew me away. Many of my clients, I was expecting a 40 to 50% increase based on the number of my clients had been receiving. When I received the 156, I just shook my head. I had no idea what we were going to do. My team members are my family. You know, I want to care for them. I want to take care of them. So I wrote a letter to President Obama just explaining to him about our 156% increase. And I sent that also to the NFIB, and they contacted me to come speak today, which I'm grateful for.
Well, you're not alone. I mean, in Indiana alone, 31% of small businesses offered coverage in 2010, and by 2015, the most recent year that I could find data, only 23% of those same businesses were able to offer coverage, a decrease of 26% in the number of offerings. And your reason, just to be clear for the record, for this reduced coverage among small business owners?
The costs have been increasing. It is just increasing out of control.
When you described how your insurance was canceled the first time, you said there were some less ideal options. One of those was MediShare, I heard from your testimony, and some other things. Could you go in a little bit more detail there?
We looked at a number of options. MediShare is called a church plan. I have a number of clients that have gone to that. It's usually a half or a third of what, even on the exchange, it would cost them. And that was one of the options that we looked at.
But just not working?
For those clients that have gone to MediShare, they are still on it. It is working for them.
Okay. Okay, thank you. And then, Mr. Troy, I think with the 30 seconds I have remaining, I'd just like to ask you, at the risk of this committee losing jurisdiction over the issue, why do employers have to be involved in the insurance market? I mean, I understand the history and all that, but why couldn't, if we changed or modified the tax code, could we not incentivize individuals to enter directly into a competitive marketplace? Why does the employer have to be involved?
I don't think the employer has to be involved per se. I just think that that is the way the system has evolved, and to change it precipitously would be to cause large disruptions. As we saw with the Affordable Care Act, the disruptions are often quite problematic. Somebody mentioned the 5 million people who lost their individual plans via the ACA. So I think the best way to go forward is to try and avoid disruptions and focus on what is working. And you have 177 million people getting health care through employers. If you were to disrupt that, the government would have an even larger hole to fill in terms of covering people.
Gentleman's time has expired. Ms. Bonamici, you're recognized.
Thank you, Chairwoman Fox and Ranking Member Scott, and thank you so much to all of our witnesses for being here today and testifying. I wanted to just follow up on what Mr. Wakita said about employer-provided health care, and also Dr. Rowe mentioned as well that insurance costs make us non-competitive with other countries. And I want to point out that that's not necessarily a function of the Affordable Care Act. I was born in Detroit, Michigan, many years before the Affordable Care Act, and everyone knew in Detroit, Michigan, that if you make something in Detroit, or if you go across a bridge and make it in Windsor, Ontario, you have very different cost considerations. Because in Windsor, Ontario, they don't have employer-provided health care because Canada, like basically every other industrialized country, has universal health coverage. So it's not necessarily a function of the Affordable Care Act that health care costs are making us unaffordable. And if we want to have a conversation about that in another hearing, I'd welcome that. Madam Chairwoman, I ask unanimous consent also to insert into the record a letter from the AARP supporting the Affordable Care Act and expressing concerns about the effects of repeal. The AARP also mentioned in the letter that Medicaid is the only safety net for millions of children with disabilities, adults, and seniors in need of critical long-term services and supports. I want to point out that in Oregon, the Kaiser Family Foundation estimates that more than 546,000 Oregonians could lose coverage if the ACA Medicaid expansion is repealed. Also in Oregon, we've been doing some great innovations with care. We have CCOs improving care and reducing costs with patient-centered primary care homes. It's really working well to provide that preventive care. And I've heard from hundreds of constituents in Oregon. In fact, thousands showed up recently at a town hall meeting that I did with our senators about this issue. They're terrified about losing their coverage. And Deborah from Rainier shared her story with me. She called my office. She's worried that she's going to lose her care if the ACA is repealed. She's in the final stages of pancreatic cancer. She's not yet eligible for Medicare. She's worried that her cancer will prevent her from obtaining coverage without the Affordable Care Act. So she's spending her remaining time advocating for those who have benefited from health reform and doing what she can to prevent the repeal of this important law. And I know her fears are shared with millions of Americans and districts all across the country. And I hope my colleagues will keep her, as well as you, Ms. Schlock, in mind as we debate this repeal. And Ms. Schlock, thank you so much for being here to share your story. I know it's not easy to come forward and talk about something so personal, but you mentioned that the type of leukemia your husband was diagnosed with has genetic links, so your family might be at risk. Can you discuss how the repeal might affect your family if individuals with pre-existing conditions are no longer protected under the ACA? And if you might mention, what would a high-risk pool do? Do you think that's an acceptable alternative for your family?
No, high-risk pool, not at all. I mean, it's actually the University of Chicago continues to work with samples from my husband to further educate themselves, and I've learned that from my own family about some of the genetic links, and being that I have a young daughter who, right there, previously was almost a pre-existing condition for being a female. The thought that 30, 40 years down the road, if she sees the same thing, she won't possibly have the choice of buying prescriptions or paying for groceries.
Thank you, and I hope we can keep your story and others in mind. Mr. Eddy, you stated in your testimony that your business had experienced some significant challenges as the health coverage you offered your employees changed, but you're hopeful that your situation is stabilized. So can you talk a little bit about how the repeal of the Affordable Care Act without a credible alternative would affect your current situation? There's a lot of uncertainty now. I know the president has said there's going to be insurance for everybody. I don't know how that plan would work. We haven't seen that yet. But how is the uncertainty of repeal and replace, how would that affect your business and business owners like you?
Thank you, Congresswoman. For the answer to that, I will reference a study that the NAM has completed called Shaping Up. The NAM took a hard look at the challenges as well as the opportunities for employers concerning health care insurance coverage. They're really looking at three broad themes with that: controlling costs, such as eliminating burdensome taxes and paperwork, expanding coverage options, such as providing flexibility for employers to cater their health insurance options, and access to better information in the form of improved healthcare IT and information sharing. I think that document would maybe tend to give some additional broader perspective than my own personal. I think that I would reference that, and that would be made available to you.
Thank you, Mr. Eddy, and I see my time has expired. Thank you, Madam Chairwoman.
Thank you. The gentlewoman's time has expired. Mr. Guthrie, you're recognized for 5 minutes.
Thank you, Madam Chairman, for the recognition. Thank you all for testifying. I appreciate you being here. And Mr. Ballenbacher, is that how you said correctly? And Mr. Eddy, you mentioned in testimony about your small businesses. And I've heard from families in my district, right when we first got back to session, a lot was going on in January, and I got a call, my office got a call from a lady, and I called her back. I want to talk to her personally, and she has a special needs son, and she was really concerned, and she's on the exchange in Kentucky, extremely concerned about the idea that she might lose her health care. It's a lot of stuff is being reported, so I wanted to assure we're going to have a transitional plan and an ability for her to move forward. But then we started talking about her plan in Owensboro, Kentucky. You have, on the exchange, you have one insurance choice. She said her husband worked for a small business, less than 50 people, didn't get health care now through that business, had to go on the exchange. Only one choice. Her child has special needs. We have great physicians in Kentucky, all over our state, but there was a particular physician that was for her child's need in Cincinnati at the Children's Hospital, and was not in network. So we started walking through her after we talked about you're going to be able to continue your current coverage, the things that we want to do in our replacement plan that will have her have better coverage. One is like, well, if it's small business, associated health plans for small business will have better opportunities to provide health insurance. If she can buy out-of-state plans, if she needed a doctor in Ohio because it had special needs for her, special skills for her child. So we started walking through that, and she became more confident as we move forward that we can improve the situation that she's in instead of being stuck in an exchange with one plan. So, but my question, so I've actually put the Employee Health Protection Act that would allow small businesses, because what we want to do is small business, because the people really trapped in this are people that are single employers, small businesses, trying to buy on the individual market or small market. And what I wanted in this bill, and I want to see how this would help you, that you could actually offer pre-Obamacare plans, pre-ACA plans. If you could go back and offer a plan like that to your employees, will that help you? I think, Mr. Ballenbach, you're a smaller business, I believe.
Yes, sir. It sure would. We feel like we have no options right now. We have a cookie cutter plan that we have to pick, and that's it. And before the ACA, we had the ability to pick the plan that best fit our particular needs.
Mr. Eddy?
Yes, Congressman, we run into the same issues. We're in the northern panhandle of West Virginia, so we're about a mile from Ohio and 5 miles from Pennsylvania. One of the issues as far as going backwards is the fact that we don't have several of the carriers that used to represent West Virginia. The ACA has weakened and actually had some of them have actually been taken over. So our options now are somewhat limited to 3 carriers in the northern Ohio Valley, and we would like to maybe move some of the provisions back that would give us more options and the flexibility that we talked about. So yes, that would be important.
And we think what we want to propose will give her more options for her son, and that's what we hope to certainly accomplish. And Mr. Ballenbacher, I think Mr. Rakita, I was out, but is coming back, asked you about a letter that you sent to the president. Can you talk about the response you got on the letter? or from the administration? I don't expect him to personally respond, but from the administration, what did you?
Sure. A month or so after I sent the letter, somebody from the shop marketplace called me just to talk about the plans that they had available on the shop network, which really wasn't any benefit to us.
Okay, well, thanks. And then Dr. Troy, in your testimony, you mentioned that innovations in large employer-sponsored healthcare benefits help to reduce costs, healthcare costs for employees, retirees, and dependents. Can you share with the committee some of the ways employer coverage is reducing costs?
Thank you. So as I was saying earlier, that we were seeing reductions in employer-sponsored costs in that period, 26 to 2010, before the ACA went into effect, and it was a result of program design changes and plan design changes on the part of employers, which included the implementation of consumer-directed health plans, wellness programs, which have been shown in many cases to reduce costs and actually improve the health of employees, which is really what we're trying to get at, and other significant plan innovations. And again, combined, these really dropped the annual increase from 11.1% in the period before 2006 to from 26 to 2010 to 4.8%. And we believe that additional innovations by employers could reduce costs even further in the years ahead. Employers are now taking this issue very seriously.
Thank you, Madam Chair. I yield back my time.
Thank you so much. Mr. Takano, you're recognized for 5 minutes.
Thank you, Madam Chair. Madam Chair, before I begin, I'd like to ask unanimous consent to insert into the record a letter from the American Hospital Association and Federation of American Hospitals raising grave concerns with repealing the Affordable Care Act.
Without objection.
Thank you, Madam Chair. Well, I'm disappointed that my colleagues are yet again seeking to undermine a law that has helped millions of Americans get health coverage while creating a more just and compassionate healthcare system for hundreds of millions more through consumer protections. Before I get to my questions, I want to speak briefly about the impact of the Affordable Care Act on my constituents. When I took office in 2013, a quarter of my constituents were uninsured. By 2015, the uninsured rate was cut in half to less than 12%, and nearly 90,000 people were newly insured. People like my constituent and childhood friend, Heather Froley. Heather had a pre-existing condition, and for years before the ACA, she was priced out of the insurance market and denied coverage. She contacted me during the first enrollment period in 2014 to let me know that she had successfully purchased a plan and was thrilled to be covered for the first time in years. The law's subsidies ensured her coverage was not only accessible, but affordable. Soon after, Heather was diagnosed with stage 2 breast cancer. In the following months, she underwent treatment, and I'm happy to report Heather is now cancer-free and doing well. Heather has told me without hesitation that the Affordable Care Act saved her life. Had she not been able to obtain coverage, she would not have been able to go to that appointment where the doctors first discovered her cancer. She was fortunate to catch the cancer before it progressed further. I don't want to think what she would have done without the ACA. Now, we know the cost of repealing the ACA. 30 million people will lose their insurance, including nearly 5 million Californians. It would cost my state nearly 150,000 jobs. But more than that, we know that stories like Heather's or Ms. Schlack's can be found in every district represented here today. Democrat and Republican districts share the same predicament. Cancer does not recognize red states and blue states. We have to take off our partisan blinders and acknowledge where the ACA has succeeded and where it must be improved. And I hope we can agree that it would be a terrible mistake to repeal a law that has saved so many American lives. Now, Ms. Schlack, first of all, I want to thank you for your courage this morning and sharing your family story. And I'm incredibly sorry for your loss and appreciate your willingness to speak here today. Now, my colleagues on the other side of the aisle seem to be in a great rush to repeal a law that insures millions of Americans and that they have any access at all to life-saving care. And it seems in their illogical haste to score political points and make good on an ill-informed promise to repeal the ACA that they have ignored the impact of their actions, especially for families who are dealing with a significant health care crisis. Can you help us understand what it must be like for those families, on top of the deep concern for their loved one's health, to be scared about Republican attempts to dismantle law that's working to ensure that they maintain life-saving care? Can you help us understand?
Thank you. Well, like I had mentioned before, I mean, when you're going through this treatment, whether you're the patient or caregiver or family friend, your focus is on wellness, and the bills keep coming in regardless of what's going on. And the fact that you don't have to worry about whether you're going to be covered or not is one less worry.
Now, I understand tell us more about the annual or lifetime caps. The fact that there were no caps
Right.
annually. How would that have affected you and your
Well,
husband?
I mean, for instance, my husband had to have, in a 10-month period, he had 12 bone marrow biopsies. Those are $4,000 a piece. Blood transfusions were a day, multiple times a week. An ambulance ride from our house to the hospital, which he had to 3 times, $2,000. And this is not counting the doctors, the medical staff, the hospital admissions. Easily, before he was even halfway through his treatment, would have maxed out a lifetime $1 million maximum like it used to be.
So this consumer protection was key. And if I had more time, I'd want to ask Mr. Eddy and Mr. Bollenbacher whether their prior policies had any lifetime or annual caps, and that might have made them more affordable to them. But I don't have the time. My time has expired, and so I don't yield back, but my time has expired.
Thank you very much. Mr. Rooney, you're recognized for 5 minutes.
Thank you, Chairwoman Fox, and thank the witnesses for being here today. I've got questions for Dr. Troy and Mr. Eddy. People throughout Southwest Florida have expressed many of the frustrations shared here today. According to Forbes magazine, an average 64-year-old woman in Lee County, Florida, has seen her insurance premiums and costs jump 135%. Under these exchanges, due to the failure of competition, most Southwest Floridians now have one choice for their health insurance. Many of them are on a fixed income. So my question for Dr. Troy is, if the failed experiment of Obamacare continues as is, what chance do our average Southwest Floridians have to see their health care costs go down?
I am too, sir, concerned about the lack of choices on the ACA exchanges, and we are having an increasing number of exchanges with only one option, as you are saying. The cost trends suggest that the chance for the average Floridian of seeing cost reductions under the ACA are very low.
Thank you. Mr. Eddy, thank you for being here as well. Glad to see another business person here who has firsthand experience with this disaster on our employees. According to the American City Business Journals, Lee County, Florida is the 3rd best place for small businesses. Employer mandates have prevented many of our small business owners from hiring new employees, and as I think you mentioned as well, many have had to reduce the hours work to deal with the cost increases of Obamacare. Can you share with us some insights on how the employer mandates have curbed jobs and wage growth?
Yes, Congressman, thank you. The obvious first one is the cost, and as it restricts our hiring capability, the cost per year. If you look at just the costs related to the mandates and the health insurance industry fees, those two alone really represent about 3 full-time equivalent employees for us. The restrictive parts of the ACA really, as I said earlier, dictate a lot of different business decisions that we make, including capital investments, looking to the future. You know, we have to, anytime we make capital investment for growth, we have to hire and plan on hiring new employees. So this is, as I said, become one of our most critical decision-making parts. And it's not just the costs and fees, it's the future, it's the uncertainty. The Cadillac tax, for example, is of critical concern because of our the curve on the costs right now by 2018 would possibly put us into that 40% additional tax rate. So it's fully encompassing, to say the least, for all of our business decisions.
Well, I appreciate that response. Like I say, I'm an employer too, and I'm used to satisfying customers, as you are. And maybe we ought to think about a system that puts the patient first, patient-centric care, where they get to make the choice instead of a top-down government mandate. What do you think about that?
I can tell you, I'm no healthcare expert, but without change, I want everybody to know that, we are all compassionate to the needs of the people. That's why we employ and try to take great care of our employees. But I'm very concerned about the long-term sustainability of healthcare in general if we don't make a major change. I'm supportive of that, yes. Thank you.
Thank you very much. Again, thank you all for being here, and I yield back.
Thank you very much. Mr. Espaillat, you're next for 5 minutes.
Thank you, Madam Chair. Dr. Troy, I appreciate in your written testimony that you stated, and I quote, "It is important to protect those who have gained coverage under the ACA. However, I am concerned that about 30 million individuals are projected to lose health insurance if the ACA is repealed. Specifically, New York State Governor Andrew Cuomo, has stated that over 2.7 million New Yorkers will lose coverage, with Republicans offering no guarantee to protect this coverage. I ask for unanimous consent to include Governor Cuomo's statement announcing the impact of the ACA repeal on the record.
Without objection.
Dr. Troy, I appreciate that in your written testimony you stated that employers, and I quote, "however, are both good at getting people covered and maintaining manageable risk pools. Public policy should be aimed at encouraging these important goals. You also mentioned the risk pools are difficult to maintain. Employing risk pools for the chronically ill is a central tenet of Speaker Ryan's A Better Way paper. I would like to know how you will separate the healthy from the ill, and considering that high-risk pools are more expensive to buy by consumers, more expensive to administer, and generally provide less coverage, how do you propose to implement these high-risk pools without it taking a real hit on consumers and patients across the country?"
Thank you, sir, for your question. And as a native New Yorker, I congratulate you for your joining Congress and joining this committee. In terms of risk, managing risk is a crucial part of how to handle any possible healthcare plan going forward. It's a crucial part of healthcare reform. One of the things about employers, and why I said in my testimony that they are good at managing risk, is that they have large pools of people who work for them, and therefore the risk pools generally tend to be better. You don't have the same kind of options such as you have in the ACA exchanges, in which you have the young and healthy people choosing not to participate, and we do have evidence that the percentage of young people in the ACA exchanges is younger than needs to be to maintain an acceptable risk pool. So I think
aren't they generally more expensive to buy? Aren't they more expensive to administer and provide less coverage?
Are you saying employer-sponsored plans? No, we have not found that to be.
High-risk pools, yeah.
We have not found that to be the case. In terms of high-risk pools, the idea is to minimize the number of people who would be in them, and that's why employer-sponsored health care is an important building block, as would be perhaps association health plans that would allow other people to join what are effectively risk pools by joining with their civic organization or their union or their religious organization, and then get the tax-preferred benefit. So the idea is to minimize the number of people in high-risk pools. But yes, of course, you are right that the specific high-risk pools that these programs would establish, that specific high-risk pool programs would establish, are more expensive because we're dealing with a group by its nature that is high risk. The idea is to minimize the number of people in those pools.
Dr. Troy, the Trump administration's recent immigration executive order has made it impossible for many foreign-born physicians and students to enter the United States. On your blog on December 2013, you discussed the worrisome expected doctor shortages, and in 2012, by a fellow at the Hudson Institute, you wrote a piece that commented on the physician shortage that this country already faces. As a healthcare policy matter, does it make sense for the administration to make it more difficult for the United States to meet the health needs of our population by restricting the number of doctors we recruit and train?
Thank you very much for that question. As a healthcare policy nerd, I guess, as you said, who wrote this paper 4 years ago, I'm flattered that people are reading the paper, and I hope it has an important policy, public policy impact. I absolutely think that we do have concerns about a doctor shortage. I've always been in favor of an immigration system that works to bring in people who are willing to work and willing to help improve our economy. And I worked in the Bush administration on the immigration reform plans that would have helped bring more doctors.
So will you support an exemption for doctors and healthcare professionals from those countries that are currently being hit with the ban?
I would like to see our immigration policy have plans to allow more doctors to come into the country, absolutely.
Madam Chair, the statement from the Association of American Medical Colleges expresses deep concerns about this immigration policies. I ask unanimous consent to insert this on the record.
Without objection, and the gentleman's time has
I
expired.
yield my time.
Mr. Bratt, you're recognized for 5 minutes.
Thank you very much, Mr. Chairman. Thank you all for being with us today. I'm on the Budget Committee, and so I like to kind of zoom in on the mandatory spending problem this country faces, and a lot of that's going to be impacted by increasing health care costs over the years, and so that's where I'm headed. And so we all appreciate the concerns shared across the aisle on uninsured, the costs. We want to get it right, but the amazing thing I never hear, and that the media unfortunately never covered, is the impact on our children with the programs, Medicare, Social Security, et cetera, going forward. So I'll just share a few facts, and then I don't know whether you all have this in your planning horizon or not, because it's 10 to 20 years off. But just the basic facts, everyone, I taught economics for 18 years, so everyone wants everything in the short run, right? I mean, utility maximization, et cetera, and we're pushing stuff off when it comes to debt, et cetera. So in Virginia, healthcare costs are going up by 20%, and that's pretty typical. Some states you can 50 or more % increase in premiums. So number one, is that sustainable? Two, Kaiser recently has come out with just a standard premium rates, about $17,000 for family of four in Virginia or across the country. That's just the new family of four premiums, $17,000. Is that sustainable? Average family income in my counties is about $65,000 for family income, 65, 17 health care. Is that sustainable? Deductibles are over $5,000 typically now for silver, bronze plans, right? Not just high deductible, it's across the board. Is that sustainable? And then my commentary is what I know is not sustainable. So currently we're $20 trillion in debt. And if you go out to CBO, the trend line's in 10 years, we're going to add another 10 trillion, likely we'll be at 30 trillion in debt. When does the bond market call that in? Is that sustainable? I don't think it is. Flip side of that is what's driving that debt. A lot of the pressure is coming from the mandatory spending programs. Medicare and Social Security are both insolvent in 15 years, roughly speaking. In 50 years, it's not clear whether our kids will have those programs at all. And healthcare costs are, of course, probably the main driver of those programs, of Medicare, Social Security, Medicaid, veterans, et cetera. And I haven't heard enough analysis of that. This is a huge ethical issue and an ethical trade-off of current generations versus the next generation. So everyone's talking about what we would all like right now, but the facts look to me, with Medicare and Social Security insolvent in 15 years and maybe non-existent in 50 years, when our kids retire, is anyone taking that into account? And so what goes with that, the main graph out at CBO also shows in 10 years, all federal revenues will go only to mandatory spending programs, right? So all federal revenues will only go to mandatory spending programs, Medicare, Social Security, Medicaid, Bush prescription drug plan, et cetera, right? So that means there's no money left for the military, education, transportation, everything we believe in across the aisle. And the mirror image of that same statement, that there's no federal revenues left, is the deficit in 10 years is expected to be $1.2 trillion, which fully funds the discretionary budget, right? So we'll be deficit financing the entire discretionary budget in 10 years. So this is just CBO facts, most of it related to mandatories, and I just wanted to open up to your comments. Why don't we just work down to Dr. Troy, why don't you lead off, just on the sustainability, and sorry I left you probably with way too little time.
That's fine, sir. I will be brief. We have a chart that we have prepared. It's called Hitting the Wall, and it talks about the period from 2025 to 2030 when we're going to have Medicaid spending hit over $1 trillion. All of the baby boomers will have retired. The Medicare Trust Fund, as you say, will be insolvent, and we are very concerned about all those trends going forward. We are also concerned about recent public policy, which puts more people onto government-sponsored healthcare programs and fewer on private programs. So we would like to see more of a reliance on this employer-sponsored care as a way to address these issues going forward. And I'd like to submit that chart for the record.
Without objection.
Yes, I think I would refer back to the concern about sustainability, not only of the health care plan, but also of the tax base if this continues to damage small companies. A large part of the tax base, has to be remembered, comes from the small businesses. As our friend Adam Smith said, there's only 3 ways to create new wealth in any culture: agriculture, manufacturing, and resource extraction. And a lot of those companies that support those industries are small businesses now. So without change, I really am concerned about our sustainability, even with the tax system. Thank you.
Thank you for bringing in Adam Smith. Thank you all very much.
Thank you very much. Mr. Grijalva, you're recognized for 5 minutes.
Thank you very much, Madam Chair. I think it's important kind of to remind as we deal with ACA and have this discussion in this panel, and thank you for being here. And as we stumble or edge toward Trump care in the foreseeable future, it's important to remember that, you know, there was 60 plus votes for repeal in this House. And at the time, it was a messaging vote. Now reality bites, that we have issues to deal with. And how do we keep commitments that perhaps are contradictory to even some of the testimony that I read from the witnesses here today? For example, President Trump said that he wanted health care for everyone. That was his, he mentioned that, and that he wanted it to be great, affordable care for everyone. That he commitment not to touch Medicare and not to touch Social Security. Congressional leaders on the Republican side have talked about dealing with the popular parts of Obamacare. No prohibition on pre-existing condition, no gender discrimination in terms of cost, preventive mandated examinations for wellness issues, no maximum caps, sons and daughters remain until they're 26. And Mr. Troy, Mr. Eddy, those two are doable in your professional, learned experience to do what the president said had to be done and to keep the essential programs that are popular with the public. That's why the public's demanding a replacement, just not merely a repeal. Are they doable at all?
Thank you for the question, sir. First of all, I'd like to state that I am not a spokesperson for the Trump administration or the Obama administration.
Nobody is. That's not the point here.
And I was happy to reclaim my First Amendment rights when I left government 7 years ago. But I would like to make the point that there are a number of serious plans that would reduce the overall cost of premiums on average according to CBO analysis, and I think that is the best way to go forward in order to incentivize people to purchase health care on their own without subsidies for some and an overall mandate. Thank you.
Yeah, and let me follow up, if I may, Mr. Troy. Part of what you also hear is that we have to eliminate the mandate. We have to eliminate the subsidy. We have to eliminate the medical device tax. High-end fees and taxes, and we have to eliminate issues that are revenue generation that allow many of the important things like Indian health care, that's part of the Affordable Care Act, that would go out the window. Community health centers and the trust fund established for community health centers that are essential in rural America and in poor America for services. Those would all go out the window. So how can, on a wish that premiums will go down, when in reality, the balance of revenue and program offerings under ACA are intrinsically tied together? How do you eliminate all the revenue generation and still have a program?
So we do oppose elimination of many of the taxes, including the Affordable Care Act, the Cadillac tax and the Affordable Care Act. In terms of CBO projections being a wish, that is how public policy is made. We make projections based on what CBO assumes that the policies will do, and that's how they're voted on. And I was pleased to see that this one particular CBO study showed that the costs would be reduced if the number of these programs in totem would be put together to lower the costs on individuals and their premiums.
I'm sorry, Mr. Eddy, but if you have any comment on either one of those points.
Thank you, Congressman. I really tell myself I should have no comment here, but what I would like to say is I think we've all learned a good bit about what works and what doesn't work in the last 5 years, 6, 7 years of ACA. You know, from my standpoint as a small business owner, I would hope that there could be a balance created between this group, actually, to work towards what does work better. I have no answer for you on that, though. Thank you.
Appreciate it. Yield back, Madam Chair.
Thank you very much. Mr. Bishop, you're recognized for 5 minutes.
Thank you, Madam Chairwoman, and thank you for the opportunity to be a part of this committee hearing today. Thank you to all the panelists. Special thank you to Ms. Schlack, fellow Michigander. Also, I want you to know, as a parent, husband, my heart goes out to you and your family, and I do want you to know that your testimony here today makes a difference, and oftentimes people don't think that, but your being here today, your personal story makes a difference, and I want to thank you for that. Higher premiums and uncovered out-of-pocket expenses, for the most part, are devastating families and entrepreneurs and everyday Americans of all backgrounds. The ACA has caused canceled policies, rising costs, poor coverage, and lack of choices for families, business owners, and employees alike. Many Americans simply can't afford health insurance. In fact, in 2015, 8 million Americans chose to pay the individual mandate tax penalty rather than to purchase insurance at all. Now, I hear from constituents every day and business owners. I have spent the last couple of years traveling the state, and just reflecting on what I'm seeing in Michigan, plans in Michigan exchanges saw deductibles go up an average of $492 in 2017. Obamacare exchanges rates will jump nearly 17% in Michigan, regardless of what Congress does this year. Insurance are leaving the exchanges, private practices are folding over, and our doctors are being forced into retirement because they cannot afford the cost to stay in practice, to comply with all of the incredible regulation. Nationally, those who currently have a plan under the exchange can expect an average premium increase of 73%, while individuals who are now just joining will see a 96% increase in premiums. The average cost of a new customer in the individual market is expected to rise $1,800 per year. We often hear, as we absolutely did here today, the argument that if Obamacare isn't implemented, costs would rise anyway. And I know, Dr. Troy, you've answered that question on more than one occasion. Just building on what Mr. Guthrie had asked you, as a health care policy expert, can you tell me, obviously prices would continue to increase, but would the costs of health care increase at the same rate under the previous system, but for the implementation of Obamacare?
So The healthcare inflation rate continues to be higher than the overall inflation rate. There has been some moderation in the healthcare inflation rate, so still higher than overall inflation in the last couple of years. CBO has looked at this and wondered what the effect of or the cause of this was. It looked at the ACA as one possibility, but it said that the biggest factor was the lingering effects of the recession in terms of moderating the healthcare inflation rate. Also, some of the premium hikes that we've seen in the last couple of years in the ACA exchanges suggest that new studies going forward might find even higher rates. And then the other thing I would say is that employers have done a lot of work in recent years to try and bring down costs, and we've seen some improvement in the costs in employer-sponsored care, even as they face the additional effects of the ACA costs.
Okay, we could have that conversation for, a lot of this conversation for many days. Doctor shortage, you were just brought into that discussion as well. The fact that the current immigration plan may have an impact on that. But can you share with me the extent to which the result of rising costs on the current practitioners and the current costs with regulation and compliance has an impact on the number of our doctors, especially those freestanding specialists, are leaving the practice of medicine?
I'm glad you raised that, because that study that I wrote back at Hudson Institute in 2013 did talk about the cost of the Affordable Care Act on our medical profession and suggested that we might have problems filling the number of doctors we need as a result of the costs imposed by the ACA, but also the lack of discretion imposed on doctors as the ACA. Doctors want to see that they actually have the ability to make decisions, and the more their decisions are constrained, the less likely they are to go into the profession.
What's the biggest regulation that doctors face that is causing the most consternation among the practitioners, that's making them leave the practice in almost overnight?
So I hear a lot of doctors complain to me about the electronic medical records and the way that it forces them to look at the screen instead of at the patient. And that when you look at the patient, that's when you get to make better decisions about the patient's health. But I would also, I know we're short on time, I would ask that that entire paper that I wrote about the ACA's impact on doctors be submitted for the record. Thank you.
Thank you very much, Dr. Troy, and I yield back.
The gentleman from Michigan would like, we can insert that study into the record.
I would, and I move to admit that to the record.
Without objection. Ms. Adams, you're recognized for 5 minutes.
Thank you, Madam Chair, and thank you, Ranking Member Scott, for hosting today's hearing, and thank you to all of the panelists. Much as of what has been discussed today includes the impact of ACA on the health and economic security of our country. Repealing it would take away vital health insurance, as we've heard, for nearly 30 million Americans, and with more than 129 million Americans with pre-existing conditions would be denied coverage. Madam Chair, I'd like to ask unanimous consent to enter into the record a letter from 7 children's groups. Thank you very much. I'd like to, Ms. Schlack, you, first of all, you've experienced terrible tragedy. We certainly want to, again, I want to add my thoughts of sympathy to you and your family and commend you for having the strength to share your story. You describe in detail the impact of ACA in terms of coverage both for your daughter and your son. And in your testimony, you mentioned that having ACA allowed you to have coverage for your daughter without having to quickly go back to work to simply to get the benefit of health insurance. So it does sound like ACA allowed you to be flexible with deciding when to go back to work after your husband's death. Is that the case?
That's correct.
Okay. I also want to raise with you, oftentimes with great personal tragedy comes the need to access mental health services. Under ACA, more individuals have access to such services. As someone who has experienced personal tragedy and currently working with those who have, how important is that mental health service, such as grief counseling? How important is that to be accessible and covered under health plans?
Thank you. Yeah, not only for myself to be able to effectively parent and continue on with my life, but also for my daughter. It's statistically shown that children who suffer a loss of a parent or live with a parent with a serious illness often have difficulty processing that, and it then translates into school issues, behavioral issues, far into beyond their young years, well into college, making not necessarily the best choices. And the fact that she and I are both able to continue with counseling, therapy for our own mental health has been invaluable, because it is a very expensive service that we couldn't have afforded otherwise.
Okay, and so actually working in this field, you believe it's important for other families to access it as well?
Very much so. Oftentimes I work with groups, peer groups, and many times that's not quite enough. A lot of times, especially children, don't want to talk about things like this with their parents, with someone in their home, and they need a third party who they can express what they're feeling and help them work through the emotions that they often don't even understand.
All right, okay, thank you. So you talked about your son, or you mentioned it certainly in your written testimony, who was able to stay covered under an employer-sponsored plan after serving in the Peace Corps. What has it meant to him to have the coverage as a young adult starting out in the world?
Well, he was right out of, he finished his bachelor's program, went straight to a master's program, as we were able to continue to cover him then, so he didn't have to work full-time and go to school. And then in their interim between graduating, starting the Peace Corps, which he did have full coverage from the government as a Peace Corps employee, but then once that service was up, he transitioned back into the U.S., his benefits stopped, and until he was able to attain his own full-time employment, which thankfully he does have, I was able to keep him covered. So it was one less thing that because frankly, the medical care he could get in Mongolia where he was serving wasn't exactly stellar, and he was able to come back and have the coverage he had had in the past, and before he started out on his own as an independent adult.
Thank you, and as his mom, I know you have peace of mind. Thank you very much. I yield back,
Yes,
Madam
thank you.
Chair.
Mr. Byrne, you're recognized for 5 minutes.
Thank you, Madam Chairman. Ladies and gentlemen, thank you for being here today. Most people expect to get their health insurance through their employer. Most people work for small businesses. So the topic we've been talking about today and the impact on small businesses is a big deal. I represent Southwest Alabama. We don't have too many big employers. Virtually everybody works for a small business. Between 2015 and 2016, for the urban county in my district, Mobile County, the increase for small businesses for their insurance premiums was 14%. And that turned out to be about $2,000 per employee in 1 year. For small business, it's a big hit. And Mr. Bolenbacher, I'm informed that you actually had a 156% increase and that you wrote President Obama about that. So I'd like to ask you, sir, did you hear back from President Obama? Have you received any subsidy from the federal government to help you with that increase? And if you don't receive a subsidy and you get an increase of that magnitude, what do you as a small business owner, what do other small business owners that you work with, what do y'all do with that?
On your mic, please.
Yes, I did write a letter to President Obama.
Did you hear back?
I had somebody call me from the healthcare marketplace through the shop.
Did you hear back from the president that you wrote to?
No, I did not. But 156% increase is not feasible.
Did you get a subsidy to help you with it from Obamacare?
No.
So how do small business people deal with an increase like that? If the president won't talk to them or write them back and won't give them a subsidy like they've given in other parts of the program?
What we were forced to do was look at options, and there were no good options. Basically, there was one plan that we ended up having to pick, which was a 78% increase. I've had other companies, other clients I work with have dropped their insurance altogether. They just cannot afford it. They've laid people off to get under the full-time employee equivalent.
So, and maybe Dr. Troy, you, Mr. Eddy, maybe y'all can answer this for me. As a result of this, have we seen a decline in the number of businesses and employees working for small businesses that have insurance? Have small businesses just said, look, we can't afford it?
I'm not aware of statistics on that specifically, but I do know there are concerns among small businesses, and I've heard stories, including by some of your colleagues today, about limitation of hiring by small businesses as a result of the ACA.
But you, Mr. Eddy?
Again, I agree with Dr. Troy. I don't have any specific statistics, but I know how it affects us, and it curtails our hiring capabilities, as well as our capital investments, which lead to additional hiring. So we plan, as long as we can afford, to cover our employees with as much coverage as we can. You know, with the high deductibles that we have today and the continuing uncertainty in the future costs, I'm not sure how long that will be able to be sustained. Thank you.
Well, Mr. Bolenbacher, I'm sorry you didn't hear back from the President of the United States. You wrote him, you're a citizen of this country, you had legitimate concern, and you had a right to get a response. He's not president anymore, so there's nothing we can do about that. Madam Chairman, I really do worry about what's going to happen to all these employees in America that work for small businesses and want to get their health insurance, expect to get their health insurance through their employer, and their employers are just getting to the point where they can't afford it. And so the employers are left with one of two choices. Either they continue to pay the high cost of this, in which case they've got to figure out a way to recoup that somewhere else. And my fear there is there'll be less hiring, fewer jobs. Or we figure out a way to get some real relief to small businesses by getting this incredibly expensive burden off of them and let small businesses do what they've done through the history of this country, which is grow and prosper and hire and provide benefits and good wages to the people of America. And I yield back.
The gentleman yields back. Ms. Shea Porter, you're recognized for 5 minutes.
Thank you. And Ms. Schack, first let me say I'm sorry for your loss, and I understand how challenging it is when there's somebody in your family, because I had a family member who had decided, he was a registered nurse, and he decided that he wanted to do ministry with music. He's a gifted musician, and he wanted to go to nursing homes and work with Alzheimer's patients. And so he was able to do that with the Affordable Care Act, and then shortly thereafter he was diagnosed with advanced prostate cancer. And the Affordable Care Act saved his life because he had access to treatment. So while our outcome was certainly better, it was a terrifying time. I am also concerned about small businesses, and so I urge my colleagues on the other side to work with us to help to reduce the costs and figure out more. The fact that we haven't been able to work together, I think, is a tragedy. But since the Affordable Care Act began expanding access to health insurance in my home state of New Hampshire, 63,000 people who didn't have it before have gained that peace of mind that we've all been talking about and the financial security that coverage provides. Now, their coverage and many others is at risk, despite the fact that Republicans have had 7 years to come up with a so-called replacement plan. The current plan looks like repeal and collapse. Insurers make decisions over the coming months about whether to offer plans for next year, and they're still hearing the story, the dog ate my homework. The stakes could not be higher. If congressional Republicans go down this road, the Urban Institute estimates that 118,000 people in my state alone could lose coverage, and 30 million nationwide. Just yesterday, the Economic Policy Institute released a report that repeal would cost 4,600 jobs in New Hampshire. This wouldn't just erase the gains that we've made, that would send us backward, and I don't believe anybody wants to go backward here. My constituents are deeply concerned, and rightfully so. I'd like to read some testimony from two of them. First is Jameson from Somersworth, New Hampshire, who shared this, and I quote, "The ACA gave me the opportunity to purchase affordable health care when I needed it most. It allowed me to get the medical service I needed without me going into more debt or standing up time after time after time, just waiting in the emergency room. Although I'm not a profitable insurance policyholder, I surely am a grateful one. Repealing the ACA would be inhumane, irresponsible, and outright foolish. And there's Jack from Rollinsford, New Hampshire, who says, before the ACA, I was uninsured due to a pre-existing genetic condition and high medical costs, struggling to afford even the most basic tests to keep myself healthy. Today, I have great affordable coverage and the help I need to live a long, productive life. So my question to you, Dr. Troy, is, today's hearing concerns with the quote-unquote failed health law. What benchmarks would you allow Jameson and show Jameson and Jack to defend your allegation the health care law has failed in New Hampshire and around the country? The uninsured rate, average medical debt, the number of plans that have comprehensive substance abuse treatment, the number of issuers offering coverage in our individual market, because all of those have shown dramatic improvement. You work with numbers. Are there any statistics you could show Jack and Jameson about access to coverage and care in New Hampshire that could possibly support the idea that this law has somehow failed to improve health care for my constituents?
Thank you very much for that question. So I believe, and I've written that there are three basic metrics for judging whether the law is a success. The number one is coverage. While you say that the law has increased the number of people covered, that is absolutely true. More people are covered subsequent to the ACA, but not as many as the law said it would, or as CBO projected that it would cover, and we still do not have the level of universal coverage that I believe that we should strive for in this country. Number two is costs. President Obama said that the law would reduce costs, bring down costs for individuals, bend the cost curve down. As Dr. Bratt was saying earlier, our long-term costs are still quite high, and we've seen very high increases in the premiums at the exchanges in recent years. And then the third, and I think really the key question that will determine whether the American people believe the law is a success, is President Obama's promise, if you like your health care, you can keep it. And we have seen disruptions in the individual markets, so some people have not had coverage as a result of had the coverage they had previously as a result of the ACA. And then there are questions of the cost we were talking about throughout this hearing imposed on employers. And if employers are changing the health care they're providing as a result of the cost of the ACA.
Okay, well, let me stop you there because I'm running out of time. But first of all, the fact that the coverage isn't 100%, but so much closer, hardly seems a reason for you to complain. It seems to me that you would want to say, well, that's wonderful, we've expanded coverage, and let's do even better and get 100%. And your second point, where the costs have not dropped, can you point out anything, anywhere, starting from your sale of your home or whether you rent or whether you buy groceries, anywhere where the costs have dropped? We all know that the rate of increase has dropped. And you yourself introduced some of those numbers earlier in your testimony. So I'm not sure what you're saying here. If you're saying that I didn't get everything I wished for, and that's how it sounds here. I didn't get everything I wished for yet. What would be the purpose of going backwards and taking it away when you've acknowledged that the increase of people who were covered went much higher? What is
Ms.
wrong
Shea
here?
Porter, your time has expired, and we'll ask Mr. Troy to submit his answer for the record.
Thank you, and I yield back, and I would very much appreciate an answer to that, and thank you.
Mr. Allen, you're recognized for 5 minutes.
Thank you, Madam Chair, and again, appreciate the panel participating today. I, too, have learned a little bit about what you're dealing with. Just 2.5 years ago, I sat in your seat, Mr. Eddy, as a small business, and dealing with not only the economy, but the increase in benefit cost and stagnant wages, which is still a major problem. I think that probably, too, we should understand that really health insurance benefits came out of the business community. In fact, it exploded during World War II when there were wage controls, and the war board allowed the companies to extend benefits, health benefits and other benefits, to compete for employers. So, and of course now the government is heavily involved, and we know that, again, costs are increasing. In fact, I have met with lots of groups that are involved in
the markets, and of course the health insurers are getting a little bit, well, they're getting a bad rap because they're blamed for the increase, but I know for a fact that most of them submitted certain reforms to the administration that would drive down costs, and they were totally ignored. And that, you know, brings me to my point here that I want to make today. And again, I don't know if this is the first time you've testified here in Congress, but you obviously see the very partisan part of what, in fact, I'm ashamed of it, really, of what happens here, that, you know, that we can't come together. I mean, we can send somebody to the moon, but we can't come together and do what's right for the American people. And that's sad, but you know, we're going to work on it. We're going to continue to work on it. Your testimony is very important to us, and we thank you for that. With that, again, you've listened to us, and we've listened to you. Dr. Troy, I would like to start with you, and we're getting to the end of this. Can you summarize in your mind, you know, where you see us going and what's best for the American people?
Thank you for that question, and I applaud your call for bipartisanship. You know, before the ACA, every piece of major social welfare legislation in this country had passed on a bipartisan manner, and that's one of the reasons that these laws were accepted and the American people moved on subsequently. When you have a law passed in a unipartisan manner, you have this situation where there's continued contentiousness about the law set 7 years later. I would like to see some kind of bipartisan reform going forward so that it would be more lasting. I'd like to see it along the lines of what we were talking about earlier in terms of building on the basic building blocks of American healthcare, which includes employer-sponsored care, which covers 177 million people, but also works to reduce the overall costs, thereby incentivizing people to purchase it on their own and not having to do it via mandate.
And what's important about what you said there is incentivize. I learned that in the business world, that the best way to get the production from your workforce is to give them incentives to do these things rather than mandates. Mr. Eddy, you have any comments about how to solve this?
I'd be in Congress if I could had a
well, that's the reason I'm here. I'm not sure I'm getting anywhere.
As I said, I depend on you all to work together to do this. But along with the repeal of the taxes, I'd like to see us consider, reducing some of the reporting requirements. The mandates generate a lot of reporting requirements, a lot of compliance issues. Also, the greater flexibility, I'd like to see the proposals and see options and flexibility improved. Thank you.
This is like my heart goes out to you for your loss. What is your recommendation? Knowing that we're $20 trillion in debt and you got a child, I have 12 grandchildren, how do we do this?
Well, again, fortunately on this side, not yours, but your side of this table, I'll put it. But really, to have a productive, efficient workforce, you need healthy, happy employees, mentally and physically. And I know it's dollars and cents, but it comes down to loyal, healthy employees that you can count on to be at work and to maintain their job.
Let the record show that maybe was the most important thing that was said here today at this hearing. Mr. Bollinger?
I believe for small businesses, we need options, we need flexibility, we need more than one choice to provide for our employees.
The gentleman's time has expired.
I yield back.
Mr. Desagne, you're recognized for 5 minutes.
Thank you, Madam Chair. Let me start at the beginning, just agreeing the comments by my friend from Georgia and by the chair. It would be wonderful if we could approach this more in a problem-solving perspective, acknowledging that we have philosophical differences as to how to accomplish that. And I say that from the perspective of being a small business owner for over 35 years. Ms. Bollenbacher, I hesitate to use this phrase, but I feel your pain. I owned restaurants in the Bay Area for a long time. And before the ACA, one of the problems I had was the cost that was going up. So For my employees who I was able to pay 100% of their cost, I found situations before the ACA where I had a manager come to me in tears, and because she couldn't afford the copay, I contributed the copay. So when we compare this, and Dr. Troy, I'd like to go back to the ranking member's comments, and how we get to a perspective of more problem solving in a bipartisan fashion, as you affirmed would be preferable. But in addition to owning a small business, Schlag, I also have great empathy from for your perspective as a survivor of, so far, of incurable blood cancer. I fortunately had insurance that I paid for that has helped me pay for the very large costs for my treatment. I will say, and I'd be curious about your experience, but perhaps just personally, as to the question about electronic records. There's somewhat of a joke about those of us who have gone through treatment, and I tease my oncologist that I see more of his back as he looks at my CAT scans and my blood, but he will say, but that's where the information is. So understanding that there's a process to introducing technology and understanding that we should have done it faster when it came to electronic records, there's still a long-term and a short-term benefit. For me, I'm an example of it. And at some point, wonderful book, Rise of the Robots, where they talk about automation. And for specialists in the medical field, I always ask when I go out to research facilities, how much is the oncologist, in my case, interpreting the results of my examinations, and how much is the computer interpreting it and telling him or her what the diagnosis should be and what the treatment should be. And what I always get is that over the course of time, the computer is doing more and more of that work. So to Dr. Troy, to follow up on the ranking members, if we're going to be rational about this, more than opinion, even research that's based on a biased perspective, from my experience, it'd be better to look at where other similar examples have worked historically and where they work right now. So in the industrialized world, one of the reasons I was so supportive of ACA and am supportive of universal health care, Medicare for all, is that that's my perspective of who we compete with. And most of those countries that we compete with, their percentage of cost of health care is smaller in their GDP than the U.S., and their outcomes have historically been better. Mongolia not included in this, by the way. So the ranking member's question about if your theories are in play right now and in practice in a similar industrialized community, where is it? What can we learn from that? And why can we be so certain that your suggestions will work when they're applied to a very complex country? And then I'll just say, lastly, from my perspective, having been very involved in the implementation of California, when I was in the legislature, we had huge struggles. We continue to have huge struggles. We worked with the California NFIB. We delayed some of the requests and the mandates on small businesses. As a small business person, I wanted to make sure that they didn't incur undue burden, as my friend from Alabama said. So in the short time left, maybe you could just elucidate a little bit on your response from the ranking member. If you're going to be rational and evidence-based and rely on as much empirical, non-biased research as possible from either perspective, it would suggest to me that we go to places that have implemented healthcare, dealt with this, and either from your perspective, being more market-based or more driven closer to universal healthcare, where has it worked and where hasn't it?
Thank you very much for that question. I certainly try to avoid the word certainty when it comes to public policy, because I think it behooves us to have modesty in our approaches and not be completely certain about anything about the previous policies or going forward. One of the reasons we spend more on healthcare is that we are, in many ways, a more generous country. We spend dollars until the last minute of life in ways that, in some of these countries, some of our Western allies do limit treatments in the last hours of life in ways that we don't. The results are certainly mixed. To some degree, we do have lower life expectancy, but part of that is unfortunately due to higher road deaths and higher gun deaths. So there are other factors at work. I don't have the perfect plan in another country. I have seen some positive results from Singapore, which does have people have some kind of catastrophic plan and also combines it with some kind of HSA that can be transferred generation to generation, and that has showed some impact in moderating health costs. But again, Singapore is a small homogeneous country, and obviously we are a very large heterogeneous one. So it is obviously a difficult public policy conundrum.
Thank you, Dr. Troy, and thank you for indulging me, Madam Chair. I have some articles on the Treasury report issued January 12th that I'd like to submit for the record.
Without objection. Mr. Grothman, you're recognized for 5 minutes.
Okay, Mr. Bollenbacher, you're kind of what I think was going to happen until the ACA stepped in. You're somebody who, the way it's described, for a relatively small employer, you have, what, 11 employees over there? You're doing a great job of managing your costs. I'd like to know what your cost per employee was, or did you feel you had your cost per employee under control with a combination of HSAs and giving some money towards your employees?
Yeah, yes, I do. We were seeing increases, 8 to 12%. The health savings accounts, the employees really liked. They were able to save money to put away for those future unexpected claims. It was manageable for us to continue that.
And your costs were still going up 8 or 9%?
I'm sorry?
Your costs were still going up 8 or 9%, or you felt you got your costs under control with a combination of HSAs and a...
Yeah, yes, sir.
Okay, so you were happy to live with 8 or 9%?
A lot better than 156%.
Okay, and is that after the ACA kicked in or before?
The 8 to 12% was before. We're seeing 156% last year.
Right. Okay. I'll go to Mr. Eddy. There are a variety of problems that business has, and I don't know whether I caught how you're handling your health care costs. But could you give us in general the type of plan you were offering your employees before the ACA kicked in?
It was a common plan with $1,000 for a single and $1,000 deductible for the family plan. As I said, it was about $13,500 per year for the family plan. I'm not sure how to describe the plan, but it was full coverage. We paid the entire amount of the plan for our employees.
Okay. Do you notice, and I guess this is either for you or Mr. Bollenbacher, does the effect, have you or other people involved in NFIB, or are you with NAM, or is that what you're involved with?
Yes, I'm here with NAM.
Right. Stories of employees being conscious, or other employers being conscious of both a desire to hold employees hours below 30 hours, or employees conscious of the cliffs in which they're going to lose their subsidies? Have you heard stories like that?
Well, I've heard the stories, but we can't experience that. That's not something that I think is pretty common.
Okay.
Yes, sir. I've been dealing with that almost on a daily basis, where my self-employed clients, the farmers, the pastors at churches, where they're right at that cutoff, and it's a cliff. And if they go over that cliff, they may pay $7,000 or $8,000 back, and it hurts them badly.
Bingo! I'm glad you're a CPA, because that's what we wanted. At first I was thinking I was asking you as an employer, but I'm not asking you as an employer. I'm asking you as a CPA. So you see that your customers, the people you fill out tax returns for, are conscious of the fact that they cannot make more money. Or in other words, they are maybe artificially holding down their compensation to make sure that they don't hit the cliff.
Absolutely. It's a big number for most of my clients.
Okay, so you find employees sometimes conscious of that as well?
Not as much as the self-employed, but yes, I have had individuals where they're an employee, they get a paycheck, maybe they sell some stock, and it puts them over the cliff, and all of a sudden they owe $2,000 or $3,000 back that they weren't expecting.
Okay. Mr. Troy, you talked about the different taxes out there. I think you talked about the Cadillac tax and that sort of thing. And you advocate repealing them. But what would happen if we repeal them? Would that make Obamacare that much more fiscally impossible?
I do believe that the Cadillac tax does not bring in nearly as much revenue as the CBO or the JCT, Joint Committee on Taxation, suggest it would. I think that the Affordable Care Act has a lot of spending itself, and so if the committee goes forward and the Congress goes forward with repealing it, along with the taxes, then it wouldn't make the ACA more fiscally responsible, but it would reduce both the costs and some of these revenues from taxes.
I guess the point I'm trying to make is if we repeal the taxes, the money's going to have to come from somewhere else, right?
If you maintain the ACA as it is, but just minus taxes. But I don't think that's a working plan on the table.
Right, but that is what would happen. I mean, when people talk about continuing the ACA, if you continued the ACA and got rid of these harmful taxes, the money would have to be made up from somewhere else, correct?
As with any program, yes.
Right, okay. Thank you for...
Thank you. The gentleman's time has expired. Mr. Courtney, you're recognized for 5 minutes.
Thank you, Madam Chairman. So at midnight last night, this enrollment period for 2017 came to a close. This morning I checked in with the folks in Hartford about how the final numbers came in. The answer that came back is that we just about pretty much held steady in terms of last year's enrollment. It was a little bit of a dip. Partly because they didn't use insurance agents to help with enrollment, which they're going to reverse that for next year. That was a bad move they made. But nonetheless, I mean, it pretty much held steady. And I make that point just because we've heard a lot of talk today and over the last few weeks about whether or not the law is in a death spiral. There was an interview recently that was reported with the American Academy of Actuaries, which I think we would all stipulate doesn't have a partisan bone in its body, about whether or not, in fact, there is a death spiral going on. And Corey Usello, the organization's senior health fellow, answered, "I don't see any evidence of that happening right now." The problem with the argument, according to Usello, is that Obamacare's enrollment is actually holding steady and not dropping off. And we know that from the national exchange as well. A death spiral is when people really start running towards the exits, and it just concentrates the sickest in the pool. And as Usello points out, the age distribution for 2017 is pretty much holding steady. In my district, which we've driven the uninsured rate down to 3.6%, I think it's almost the lowest of any member's district on this committee, and that's because of a grassroots efforts with libraries, community health centers, hospitals, insurance agents up until last year, who really just flooded the zone in terms of trying to get people help and assistance that took place. And it did it and I would just share this because as a former employer, I think the description of your problem is exactly the sore spot that we need to address, Mr. Bollenbacher. But frankly, it is not a monolithic story that's out there. Willimantic Waste, which is a trash hauler in my district, they have about 200 employees. I got a letter from the HR director who indicated to me, and I'll just read it quickly, "I was skeptical about the claims that the ACA would help level out the cost of our company-sponsored health plan. But the numbers have come in, and over the past 3 years, we have seen a decrease or no increase in our premiums every year. 2015, minus 2%, 2016, minus 1%, 2017, 0%. And again, I'm not saying that to, in any case, diminish or your comments, but the fact is it is really not monolithic that's out there. And what we ought to be doing is focusing on questions about whether to have a reinsurance mechanism, which was in the bill and unfortunately got stripped. It was part of the Republican Medicare Part D plan as a way of leveling off premiums through that. Very successful. We use it for flood insurance. There's ways that, again, and this is coming from Connecticut where we have a lot of insurance companies, that's the biggest weakness that they identify in terms of why the 2017 spike increased. But Standard & Poor's even then said it appears to be just a one-year phenomenon. So, Madam Chairman, I would like to submit this story from the Academy of Actuaries as well as Willimantic Waste paper for the record.
Without objection.
Thank you. And just to go back to, one bipartisan ray of hope here is on the Cadillac tax. As many know, we teamed up last year on a bipartisan basis, pushed it back to 2020. A bunch of us did it back in 10 and pushed it out to 2018, but nonetheless, there is a strong feeling that this is a really totally inefficient way of trying to accomplish some type of goal, which is really just to shift cost to businesses and employees. And I would just say, Dr. Troy, you point out that the CBO study, it really is not a traditional tax analysis. It's assuming an income windfall that will happen as employers don't incur as much cost in terms of paying higher premiums. I just wonder if you could comment in terms of there really is no study that has ever really demonstrated that sort of backboard basket that they're describing, is it?
Thank you so much for that question, Mr. Courtney, and I would like to applaud you for your bipartisan efforts to eliminate the Cadillac tax. Thank you for that. We have done a number of studies at the American Health Policy Institute about the deleterious impact of the tax, and we looked very carefully at this question of how much revenue it would supposedly raise. In doing so, we found that not only would it not bring in as much revenue as CBO and the JCT projected, but also that to the extent that it is imposed and employers are trying to reduce costs in reaction to it, that the reduced costs are not necessarily going to employees as the CBO study projects or assumes. We talked to employers, and 71% said that it would not lead to increased wages. So I just think it's on unfounded assumptions. Thank you for your leadership.
HR
on this issue.
173, and I think we could do it on the consent calendar if it was brought up tomorrow. Thank you. I yield back, Madam Chairman.
Thank you very much. Mr. Thompson, you're recognized for 5 minutes.
Madam Chair, thank you for this hearing. As someone who arrived in Washington to serve in January of 2009 when this original, and I won't say it was even a debate, I came here with 28 years of healthcare experience, nonprofit community healthcare experience. My time off, I volunteered as an EMT, showing up at the homes of my neighbors of all times of the day and night, or mostly the night when I was home, to respond to health care needs. And there was no debate in 2009. In fact, those of us who came here, and there was a lot, my good friend from Tennessee, Dr. Rowe, came here as a physician. There was a lot of us with health care experience, and a lot of friends across the aisle who had great experience. None of us were welcome to the table. And we wound up with this very partisan legislation that was shoved down the throats of the American people. So I appreciate this hearing. I think this is a part of a dialogue that we've had for some time with the American people, but also among ourselves. Respect that there are differences, but the fact that we are proceeding in a way with transparency to do better. I happen to believe that our nation's healthcare policy should be one that promotes the healing and the health of all Americans without hurting millions. And that's not what we have today. And I also believe this debate should be conducted based on facts and not fear. So I really caution all my colleagues, and especially those across the aisle that I've heard just in the past few days, it's been about the fear and driving the fear. That doesn't help this process. And so one of the things I heard was that we have no plans. And so I'm going to be offering this for the request unanimous consent for the record, but this is a submission for the record I have. This is a compilation of replacement plans or improvement plans or whatever you want to call it, plans for health care. Just some of the titles on this first page: Patient Freedom Act, Obamacare Replacement Act, A Better Way or Vision for a Confident America. That's more of a vision. Patient Choice, Affordability and Responsibility Empowerment Act, HR 5284, the world's greatest health care plan act. That was creative, I guess, in title. Empowering Patients First Act, which, by the way, was a version of something that I had co-sponsored back in 2009 before the Affordable Care Act came out of the back offices here in Washington, and that's been introduced in both the House and the Senate. And the American Health Care Reform Act, which actually the prime author of that is my good friend from Tennessee, Dr. Rowe, that he referenced, that's page 1 of 6. And so these are requesting unanimous consent to present this a list of detailed plans on how to reform the health sector from members of Congress. Some of these are from presidential candidates, some scholars and think tank community, and other top conservative thought leaders.
Without objection.
Thank you, Madam Chair. I really do appreciate that. I have some questions. I have some concerns in terms of access. My observation is just because you have coverage doesn't mean you have access to health care. And I think that was the flaw of the Affordable Care Act. It focused on health insurance, not health. And I just look at premiums and deductibles. I mean, we can look at all different things, but the deductibles, which we really haven't talked about today, It was reported to me about a constituent I have that was recently diagnosed with cancer, that because his deductibles are so high today, dramatically higher than what they were, grew faster than what they should have, he's made a conscious decision not to pursue care or treatment, because when he looks at that annual deduction, at his age, he would really like to be able to pass something along to his children and grandchildren. That's an awful situation that we've put that individual in with these deductibles that are, and again, you can have a card in your purse or your wallet that says you have coverage, but do you really have health? And so I like this debate we're having, and look forward to it. And I've managed to use all of my time, but Dr. Troy, are there any, you mentioned innovation, flexibility, and employer-sponsored benefits can help reduce the cost of health care for employees, retirees, and dependents. Can you give me just one example of that innovation?
Sure. So just one example, right now, I have been working with a group of employers on something called the Health Transformation Alliance. This is a collection of over 30 employers who are working together, sharing data, looking at how to proceed based on actual facts and data. We talked about that here in the panel, in a way to improve the health of employees. And then they're going to go forward with a pharmaceutical initiative, a medical network initiative, based on the data that they come together with in order to get better results and better costs.
Very good. Thank you, Chairwoman.
Gentleman's time has expired, and I recognize now Mr. Mitchell, who's been very patient.
Thank you, Madam Chair. Actually, the witnesses have been very patient, and we should commend you for your endurance, if nothing else. Thank you for being here. I am from Michigan. We have 15 counties that have one insurance carrier right now. Another 25 have only 2. 80% of the plans in Michigan are much narrower now in terms of providers than they were in 2017. Dr. Troy, is there any mechanism within the ACA or any hope within ACA that situation will improve in Michigan, which is in fact a national phenomenon as well? Do you see anything coming out of ACA that could possibly fix that?
I don't see anything coming out of ACA that would fix that, and I mean, ACA is kind of a static thing right now, and the conversation right now is not about putting a new mechanism in ACA that would lead to those improvements that you're seeking.
I'm not sure we could identify a new mechanism which would cure that, but yes, I don't see anything there either. Before I joined this esteemed body, I was a CEO of a mid-sized company, not a small company, a little larger than yours. The impact, however, was similar in that year one, health insurance costs are going to go up about 50% in year one, not quite 157%. Question for the 2 employers in the group: how did you manage that cost increase within your price and your operating structure? How did you manage that cost? I doubt you're able to pass that on to your down the chain. How did you manage that?
Again, the timing couldn't have been worse. As was stated, I've been with the company 21 years now, and I started as the new CEO, president and CEO on January 1st, 2009. I'd heard a lot about the potential for the Affordable Care Act coming. We saw our premiums, our deductibles, the mandates, the costs. Again, I'm not sure how you manage with uncertainty. I mean, one of my sayings to my management group is as we lose control, increase your options, okay? And ACA took all of that away. So that really took one of my management philosophies away. But when you're looking at annual increases in the mandates and the healthcare, the health insurance industry fees, 3% per year of our premium cost increasing, 2.5% per year from the mandates changes. And these have continued. It's not a one-time increase. These are annual increases.
Were you able to just pass those costs along, Mr. Eady, to your consumers?
We have not had the ability to increase our prices for the last 5 or 6 years because we haven't seen any GDP growth. So our company hasn't grown, but maybe 2.5% to 3% on average. That's in revenues. Our profitability is down significantly.
Sure.
With the increase in the mandates and insurance and taxes and fees is one thing, but the others are the increases in premiums. It's taken away, as I said, I would like to have grown significantly more than we have. We've had the ability to increase our international markets, but we haven't been able to do that as fast as we would like to.
Another question, Mr. Bolenbacher or Mr. Edie. We talked a little bit briefly, a colleague talked about deductibles. We haven't talked about much of that here. I know I've seen the deductibles go wild and for myself and the people close to me. What's been your experience in terms of deductible costs, the increases over the last several years?
The deductibles I'm seeing have increased from 5 to 8 before up to 12,000 recently.
In your opinion, I mean, you're close to your employees. Does that adversely impact their willingness or ability to actually access care? I agree with my compatriots that health insurance doesn't mean you can access health care these days. What impact does it have on your employees?
Yeah, it definitely does. It's a big hurt for them.
Mr. Edie, any feedback on that?
Well, we're a little different. Again, we have a fully employer-funded, HRA, the health reimbursement accounts. So it's a little different for our employees. We still cover 100% of the deductible.
Well, that's admirable and not commonplace, I don't think.
Again, it's admirable, and it creates a lot of challenges, and we know it's not sustainable.
Thank you. And I'll yield back, Madam Chair. Thank you very much.
Thank you very much. Mr. Lewis, you're recognized for 5 minutes.
Individual market that has been hit the hardest. If in fact you look at Minnesota, it's been hit the hardest. The state of Minnesota had to just do an emergency $310 million, not subsidized premium plan, we'll call it that. So when we look at what repeal and replace might look like, or repeal and repair or fix might look like, we know what the status quo looks like. Before I came to Congress, I was a sole proprietor like many of your member businesses. I went through 3 insurers in 5 years. My premiums tripled to the point where we were paying $2,200 a month for a $10,000 deductible. A lot of folks here have said health insurance is not health care access, and that's certainly true. Has that been the experience of some of your members?
Yes, it has. And I would add that before the ACA, most of my clients had insurance. If not all of them had insurance, and many of them have been dropped from their insurance and been forced to go on the marketplace.
Let's talk a little bit about the employer-sponsored market, because it hasn't just been the individual market. The 10 essential wellness benefits, the minimum amount of coverage that came down from the ACA, so that you as businessmen and women had to buy this particular plan that the ACA dictated. Repealing some of those, Mr. Eddy, would that solve some of the problem? Repealing some of those mandates?
Excuse me. I believe that it would, Congressman. Yes. Again, that is one of the options that we're looking to improve upon, having that as maybe another option that we can choose from.
You know, this committee and this Congress is dedicated to making certain no one slips through the cracks. We're going to have high-risk pools or some mechanism for people with pre-existing condition. But I want to get your take on portability and how that applies to people who have that very real problem of pre-existing condition. They can't get coverage. When people get their insurance at work and they work 30 years or 25 years and then they get a little older like me and a little sicker and then they lose their job, they're thrown into that individual market. And now they're trying to buy insurance the first time and telling the insurance industry, well, I'm going to have a lot of claims here, but I'm just starting my premiums. If we could unlock some of that tax advantage from the corporate side to the individual side, would it increase portability and solve some of that problem? Dr. Troy, go ahead.
Yeah, as I was saying in my testimony earlier, that some of the Republican plans call for something along the lines of association health plans, which would allow individuals to band together and purchase health care in a tax-preferred way in mechanisms other than just through their employer. That would include your civic organization, your religious organization, perhaps your union. And I think that would help unlock the job lock you're talking about and also provide possible additional portability.
Mr. Eddy?
Obviously, I think it's a good thing to be able to have the portability. supportive of the pre-existing, not having pre-existing conditions. So, yeah, I think that would help tremendously.
And of course, the best way for people to be able to afford health care is to have a good, robust, productive job. And to the degree that these sorts of regulations, including the ACA, have hindered the economy and hindered your ability and your members' ability to employ people, that has a real impact on health care access too, does it not? Thank you all. I yield back my time.
The gentleman yields back. We were expecting Mr. Smucker, I believe, and there he is. Mr. Smucker, you're recognized for 5 minutes.
Thank you, Madam Chair. I appreciate the testimonies from all of you. I can tell you businesses in my community have been out throughout the last year during a campaign talking to individuals and businesses, and then just recently during one of our weeks back in the district, met with a few businesses. The Affordable Care Act and the impact on health insurance in their organizations and for their employees is top of the list in terms of their concerns about issues that will impact their ability to continue to do business as they have in the past. They're very worried. I'm thinking of one a husband and wife who own a company, about 15 employees, who see their employees as a family, and being able to help provide for their medical needs is an important part of sort of how they feel about their employees and the makeup of the company. And so I'm glad that this is a top priority for us here, and I look forward to building a better healthcare system, working with everyone here to build a system that will work for everyone. Dr. Troy, as you know, ERISA is the backbone of the employer-sponsored healthcare system that we're talking about. Since 1974, it has allowed multi-state employers to offer uniform benefits to their employees across the nation, reducing costs and allowing for innovation. ERISA's preemption of state laws is a key component of the law, and one that you said needs to be strengthened. As we consider reforms to the healthcare system, how would you recommend the committee strengthen the ERISA preemption?
Thank you very much for that. Good question. First of all, ERISA significantly reduces administrative costs by allowing multi-state employers who self-insure to offer a uniform set of health benefits that are generally not subject to the 50 different state laws. So in terms of strengthening it going forward, we have been concerned about the increase in state fees and taxes on self-insured health employer benefits in recent years. Some states have imposed fees on healthcare claims of self-insured employers, including Alaska, Kentucky, Maryland, Massachusetts, Rhode Island, Vermont. So we're concerned about those kinds of taxes going forward, and we want to make sure that as we talk in the ACA repeal and reform effort about ways to use state flexibility, which I applaud, that we make sure that we still maintain the ability for employers to have that ERISA preemption.
Thank you very much. Appreciate that. And again, I'm very much looking forward to working with my colleagues in this committee, with the chair and with other members of the Assembly to rebuild an effective healthcare system where everyone can have access to the healthcare that they need at a price that they can afford and with a doctor that they choose. Thank you.
You yield back. Thank you very much. Well, even though I think I have the very best questions, I saved mine to the end so that if people want to be going other places, they can do that, since I know I'm going to be here till the end. So I want to say again, thank you to all of our witnesses for being here. Mr. Bollenbacher, yours is a story we've heard over and over again. The health care coverage you had as a small business before ACA was working for your company and what your employees wanted. However, the ACA forced you out of that coverage. several times, in fact, as you've described, and added cost and burdens of lesser coverage. Can you tell us what your employees liked about the previous coverage that you're not able to offer them today because of this failed law?
The plan we had before met their needs. It was affordable. They really liked the health savings account feature. Most of my employees are fairly young, fairly healthy, and they were able to put money away. As an employer, we put in up to $3,000 per year to their accounts. Even when one lady had a baby, she had money in her HSA to help pay for that, so she had no money out of pocket.
So it sounds as though what they liked is having control, more control over their health care dollars and their health care cost than is available to anyone under the ACA.
Yes, ma'am, that's correct.
That's wonderful. Thank you. Mr. Eddy, you mentioned in your testimony that one of the most challenging aspects of the ACA is the effect it has had on your employee-employer relationship. Most employers fiercely protect that relationship and do not want to do anything to harm it. Can you talk about how the ACA forced this tension between you and your employees? Did your employees understand that it was the ACA and the federal government placing new requirements and costs on the company that was forcing you to make difficult decisions?
Of course, I try to educate our employees, but more specifically our United Steelworkers Union, that their best interests, as always, are our best interests, and that we try to take care of them. The tension obviously arose when we were trying to negotiate an increase, or actually not an increase, but for the first time ever, that they would have to co-pay a little bit. And with that, they know because I told them that it was ACA, but they looked to us to take care of them. So from their standpoint, it was a company responsibility, to take care of that. We've had a situation where, for years since I've been the CEO, I see every employee on the floor on their birthday, as well as many other days during the year, and they were impressed with that. But after the negotiations on our last contract and having to implement, and even with the staff rep agreeing to it, a little bit of copay, again, $35 per pay, there were several folks that felt that we let them down, and explaining to them that the cost increases were not, we couldn't sustain as a company. Obviously, the union agreed to it, but we also had to increase their pay rate over the life of the contract, 4 years, to help offset those costs. So it cost us, but again, we were trying to incorporate more accountability for them.
Thank you. Dr. Troy, there were some comments made about other societies in the world these days who provide, quote, free health care to their citizens. And you mentioned Singapore being a rather homogeneous society, much smaller than we are. We're often compared to Switzerland. I don't know the exact population of Switzerland, 7 million people or something. Canada, 35 million people. We have about 30 million people. Is there any other similar culture to ours that provides free health care, quote, free health care to its citizens?
Look, we are a unique nation. I am a proud believer in American exceptionalism, and I know that we are different. We have also tried to be more reliant on private sector healthcare and the market. We're not completely there because it's a mixed system. So I think it is hard to compare our approach to different countries and say we should adopt let's say, the British model or the Canada model. Even though we are close friends with those nations, we have different systems, and I don't think their systems would work if imported here.
Thank you very much. I would like to thank again our witnesses for taking the time to testify before the committee today. Other members have said to you, thank you, and that being here does make a difference. And I would like to say that to you also. I'd now like to recognize Ranking Member Scott for his closing remarks.
Thank you, Madam Chair, and thank you for having this hearing. It gives us an opportunity to flesh out many of the problems. As one witness said, we all want less cost and more flexibility. We have a plan, the Affordable Care Act, where the costs have gone up, but the studies have shown the costs have gone up at about 1/2 the rate they'd been going up before. People with pre-existing conditions can get insurance at the standard rate. There are no lifetime or annual caps on coverage. Women aren't paying more than men, and instead of millions of people losing their insurance every year, 20 million more people have insurance than they did. There are improvements we know we can make. We could insert a public option, so in those states where the competition isn't what it should be, you would at least have a opportunity to buy the equivalent of a Medicare card, or you could go to a single payer plan, which would get the health care out of the employer costs. There are a lot of things we can do, but we still have complaints about the present situation, but it's hard to debate when there is no credible alternative. One thing that is conspicuously omitted is, well, what could we do? What could we do better? We've heard about the problems with small businesses. We didn't hear about the horror stories of small businesses. If one of your employees happened to have diabetes or you had extremely high costs, you're unlikely to get affordable health care under the old days. Now you can get it at the standard rate. But what is the alternative? We haven't heard that. We have seen some initiatives taken by this administration that have been counterproductive. We had an executive order right after the inauguration, which essentially suggested a repeal of the Affordable Care Act without details, causing great concern and confusion in the insurance market. We have the executive order on immigration, which, as many of the hospital associations have indicated, disrupts their ability to get students and professionals from other countries. We had the ads pulled at the last minute, making it more likely that the healthy, younger enrollees might not get the word and might not enroll. That just increases the cost for everybody. So we have a lot of work to do, but until we have some credible alternatives, it's hard to have a coherent debate. I would just hope that we would agree that we're not going to do any repealing until we have a replace ready to go. And if that's the discussion, we have something to talk about. But if the idea is to repeal and inject total chaos in the insurance market, making it likely that nobody can buy insurance, we're not going to be very cooperative in that effort. And so, Madam Chair, thank you for having the hearing and allowing these issues to be voiced.
Thank you, Mr. Scott. I also am going to enter into the record some facts about our situation before the Affordable Care Act and during the Affordable Care Act, key facts on Obamacare and health care. There have been so many numbers tossed about here. Your members, you've just said 20 million more people have gotten health insurance, but your members have thrown around the number 30 million are going to lose their insurance. So it's a little difficult to keep track of all of these numbers that are being thrown around, but I do intend to put a fact sheet into the record today. 48 million Americans did not have health care before the Affordable Care Act. I happen to have the numbers on that, and I'll be entering that into the record. I think I just heard you say again that there are no credible alternatives, and yet Mr. Thompson just sat here 5 minutes ago and presented 6 pages of bills that have been presented as credible alternatives. And so I think we have to constantly do fact-checking around here to give the real facts about what's happening. Mrs. Schlock, I want to say, along with my colleagues, that we're sorry for your loss, but I was very intrigued in your comments that all of the examples you used about the great coverage that you got came under your employer-sponsored health care as a result of your husband's terrible illness and not as a result of the ACA. And yet it was implied that the coverage that you got came under the ACA. So we all want to share our concern and support for you and your loss. But I noted that in your written testimony as well as in your spoken testimony. So I do think that the hearing today has been helpful and I think has brought out a lot of good information about the negative impact of the ACA, particularly on working people in this country. That's where I think the real problem has been. And I would like to thank you all for coming again and tell you that we look forward to working with you on an alternative to this. And with that,
Madam Chair, may I make a brief comment, just very brief? Because I think Ms. Schlock's comment was she had employer-based coverage as well, but her husband died, and
Right.
she lost the employer, but had the marketplace as the safety net.
thank you very much for that clarification, Mr. Scott. There being no further business, the committee stands adjourned.